من لساني يفقهوا قولي والحمد لله رب العالمين. So I would like to again say thank you to everybody who have come and joined us. Firstly via the WebEx application, all our current and former members, our full members of REC as well, and especially the new prospective new members of new associate members of REC who will be trained during this morning session and the afternoon session. We would like to also welcome everyone from UiTM system, lecturers, administration staff who are joining us via the YouTube channel. Thank you for spending your time with us. We really hope that this workshop, this talk will be beneficial to all of you. And without further ado, I would like to invite the chairperson, the chairman of Research Ethics Committee UiTM, Emeritus Professor Datuk Dr. Raymond Azman Ali to give his welcoming speech. The floor is yours, Prof.
Okay. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Thank you Saudara Hisham. Saudara Hisham is the pengacara atau MC untuk bengkel. Alhamdulillah ya, kita memanjatkan kesyukuran ke Hadrat Ilahi kerana dengan limpah kurnianya kita dapat berkumpul dan menyertai REC Associate Members Workshop dan Hands-on Session bagi tahun 2024. Juga ini merupakan satu sesi taklimat juga ya bagi semua peserta. So selamat datang ke bengkel Jawatankuasa Etika Penyelidikan untuk ahli bersekutu. Bersama kita pada hari ini seperti yang Encik Isham beritahu ialah ahli-ahli bersekutu yang telah dilantik dahulu dan yang masih dalam tempoh pelantikan, ahli-ahli bersekutu yang bakal dilantik dan juga ahli jawatankuasa etika penyelidikan. Bengkel ini juga disiarkan secara langsung secara live streaming melalui YouTube rangkaian TNCPI supaya semua warga UiTM dapat menyertai bengkel ini ya. Tujuan bengkel ini adalah untuk melatih bakal ahli-ahli bersekutu yang baru dan juga melatih semula atau retrain ahli-ahli bersekutu yang sedia ada serta ahli jawatankuasa JEP atau REC dalam kaedah, prosedur dan juga asas penilaian cadangan atau proposal penyelidikan yang dikemukakan kepada jawatankuasa etika penyelidikan UiTM. Mudah-mudahan bengkel dan taklimat ini akan memudahkan dan juga meningkatkan prestasi proses penilaian projek penyelidikan terutamanya yang melibatkan manusia dan juga meningkatkan kompetensi ahli-ahli bersekutu jawatankuasa etika penyelidikan. Akhir sekali ya, saya ingin mengucapkan ribuan terima kasih kepada Timbalan Naib Chancellor Penyelidikan dan Inovasi dan juga Research Management Center di atas sokongan padu yang diberi kepada Setiausaha Jawatankuasa Etika Penyelidikan Dr. Khasnur ya dan semua staf Sekretariat Etika Penyelidikan, penceramah dan juga facilitator bengkel dari kalangan AJK REC dan semua peserta yang hadir. So I hope you enjoy the workshop and stay until the afternoon ya. Sekian wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you Emeritus Professor Datuk Raymond for that inspiring speech. So without further ado, I would like to just brief you with the tentative of our program today. So for your information, all of the tentative and details about the workshop and the talk has been shared via your Google Calendar. So You can look at the tentative today. So for today, we expected to start at 8:30, 8:30, which was done, which is the opening remark by the chairperson of REC. After this, we will have a photo session in short, and then we'll start with the first talk by our secretary, newly appointed secretary, Associate Professor Dr. Hasnul Abdul Malik, and then we'll be followed by another talk by two of our REC members, Prof. Dr. Ana Abdul Ghani and Associate Professor Dr. Dalile Kaurandawa. And then we'll be followed by the third speech by Dr. Aimi Nadia Muhammad Yusof. Then we'll be having a short break. And after that, there are two more talks by me first, and then by Associate Professor Dr. Nurziatun Ismail Han. And then at that will conclude our lecture session, our morning session, and that would end at 12:30. And for the prospective new associate member, you are expected to join the hands-on session starting at 2 p.m. to 5 p.m. A separate invitation has been sent to you, so you can check. You can join via the different WebEx link there, and in that link in that Google invitation, we have actually sent you a different a guide for you to read, and if you have read it, you are expected to try and review one set of sample question, which can be viewed here. You are expected to download the reviewing form REC 9 or 9E and complete all four questions and upload it in this folder that we have given you, as well as you have to complete and sign the observer confidentiality agreement, right? So this is the grouping list, right? You can find your question here, your name and the question assigned to you, as well as the folder in which you have to upload your work. So this is the example. You have to follow this example, download this, create a folder under your name, and then make sure you submit all these four documents, because one is for confidentiality agreement, and then you have sample 1 to sample 4 that you have to review using REC 9 that can be found in this document. So let's say if you are assigned to do set A, so you just do this. There's 4 sample question, and please download the review form here. Okay. So you can also read the rest of the guide. I think it's quite straightforward, and you are expected to be active during the hands-on session, and you will be sort of like assessed based on your participation as well. Okay, I think with that, I conclude my briefing, and perhaps we can start with our photo session. So I would like to invite everyone to switch on your video. Okay, and perhaps the secretariat can be ready to take picture. Okay, so yeah, yeah. Okay, so I'll take the first picture first. Okay. Next page.
Just keep on smiling.
Yeah.
You don't know which page you fall into.
Hold on to your beautiful smile. Third page. There are quite some pages here. Yeah.
Ada gaya bebas ke Syam?
Gaya bebas you can if you can show make sure we can see all your gaya bebas, of course. You are free to do your gaya, Prof. Okay, I think we are done with the photo session. So thank you very much. You can keep on your video if you want. It's okay. So without further delay, I would like to invite our first speaker, Associate Professor Dr. Hasno Abdul Malik, to present her talk entitled Pengenalan Fungsi dan Tanggungjawab Ahli Bersekutu Jawatan Kuasa Etika Penyelidikan. So the floor is yours, Dr. Hasno. Dr. Hasno, you are muted, I think. We can't hear you. Third page. There are quite some pages here. Yeah. Dr. Hasno, can you? We can't hear you still.
Bebas ke Syam?
Gaya bebas you can if you can show make sure we can see all your gaya bebas. Of course. You are free.
Okay, Bismillahirrahmanirrahim. Thank you very much, Encik Syam. Very good morning. I bid to Prof. Raymond, our chairperson for REC, all the board members, and also all the participants, associate members, REC, and all other entities involved in the application of ethics. I'm just going to get my slide into a display presentation mode. It's just a bit slow. Hold on a second. Okay. So so we have around 45 minutes, probably less, I think, if we can leave some time for discussion. So here we're just gonna explain to everyone about roles and responsibility and the ecosystem as a whole with regards to the ethics applications. So sorry, I have this thing. Okay, so content will include introduction to the JEP, the role and function of the associate members, and just touching minimally what are the three categories for ethics application, and briefly looking at the timeline upon receival of ethic proposal to be reviewed by the associate members, and that will follow through with the flow chart. Then we will touch about the application outside the RED system, with regards to the undergraduates and postgraduates involving the coursework. So lastly, we will just touch about the whole ecosystem and see where we are. Sometimes we are not just at one point, we are located at several points within the ecosystem. So next slide, hold on a second. Okay, let's just go through. I would like to introduce you to the Research Ethics Committee members. Okay, so in the setup of the committee, we are governed by some rules and regulations. So based on our term and reference, so within the members, we will have at least one independent members from the outside institutions. At the moment, we have two. Secondly, all of our members, majority lah, will have the expertise and be the professional academicians so that they are able to analyze and analyze the proposal. Thirdly, we must have a representative from the Islamic studies. We have two layperson, which is not affiliated with UiTM as well, among our members. And we also have other members, other members with the right expertise and professionals to deliver the needed kind of like review for the proposal. And we also have academicians and professional from the law background. So next, this is the updated Research Ethics Committee. We have our chairperson, Prof. Raymond. We have two deputy, Prof. Salmi. So going back to Prof. Raymond, he is a neurologist from Faculty of Medicine. Prof. Salmi, Deputy Chair 1 is a psychiatrist from Faculty of Medicine. Our chairperson 2, Prof. Hafiz, his expertise is in tourism economy. He's from the Faculty of Hotel and Tourism Management. And then we have 16 internal members. Prof. Rohana is our endocrinologist from Faculty of Medicine. We have Prof. Teh from whose expert is in pharmacology from Faculty of Pharmacy. And we have Prof. Maria, who's a gerontology from Faculty of Health Sciences. We have Prof. Izwan, who is a respiratory physician from the Faculty of Medicine. And we have Prof. Amal, whose expertise is in the contemporary Islamic studies, and she's from the Academy of Contemporary Islamic Studies. We have our Prof. Dalilia, whose expertise is in family law, and she's from the Faculty of Law. Prof. Nurziatun is our expertise in forensic accounting and financial criminology, and she's from the Faculty of Accountancy. We have Prof. Suraya, whose expertise is from primary care medicine, and she's from Faculty of Medicine. We have Prof. Tarita, whose expertise is in dermatology, and she's from Faculty of Medicine. Prof. Tuhaira is our chemical pathologist expert, and she's from Faculty of Medicine. We have Prof. Sayang, which is our internal member 11. Her expertise is in statistical computing and modeling, and she's from the College of Computing, Informatics, and Mathematics. Our Dr. Aimi is from Faculty of Medicine. Her expertise is in medical ethics. So you here can see there's a variation of expertise in here. We have Dr. Farha, who is a clinical periodontology from Faculty of Dentistry. And we have Dr. Noor Farhani, who's from the Academy of Contemporary Islamic Studies, specializing in halal executive trainer. We have Dr. Suhana Aiman. She's from Faculty of Sports Science and Recreation, and she is an expert in sports physiology. we have actually Professor Dr. Zamzaliza, who is from Faculty of Health Sciences and expert in nursing. We have our independent members, Prof. Nur Azmi, who is an endocrinologist from IGN, and Dr. Samsul, who is our another independent expert from KPJ Dental Specialist Center, who is expert in maxillofacial surgery. And we have two layperson, Mr. Saiful, who is an architect who's in architecture and management and works in the SNO Architects Berhad. And we have Miss Sufina, our other layperson, who is an expert in retail and architecture. So just going through the JEP, just quickly, that we are governed, our Punca Kuasa, we have is direct from the Vice Chancellor. So, but the JEP, the Secretariat is report all our findings and reports on a monthly basis to JKIPU, which then will be brought forward to the MEU. So the objective of the JEP is basically to assess ethic applications proposal based on the guidelines given. For example, the standard good clinical practice guideline and Malaysian, and also the Declaration of Helsinki. But we also have put all this into place and come up with our own guidelines. So next. Okay, if we want to make comparison to the differences between the Research Ethics Committee and also the Jawatankuasa Penyelidikan Negeri of Faculty, is that the REC is an independent body, so it goes direct to the Vice Chancellor. We are not under any, we are independent, that we are not linked to any departments or faculties. And they are being appointed by the Vice Chancellor, and the associate members will be appointed by the TNCPI. Okay, and the task basically is to assess and then to propose whether the ethics application based on the categories given is appropriate. And yeah, that's basically it really. If you look at the comparison. So touching on the associate members, right? So associate members is basically a right-hand person, I would say, under the Research Ethics Committee. So the main task is to help up with the REC in applications with regards to ethics application. And not only that, associate members is an important entity because you are also the person who would be around at the faculty level, at the ERC level to disseminate the information and knowledge, to impart that knowledge onto people in that committee, and to support the task for the Research Ethics Committee. So basically in this diagram, you can see that the Research Ethics Committee is on the right there. So we are here based in Shah Alam or within our faculty, but the associate members, we have around at the moment 252 are located all over UiTM in Malaysia, okay, helping out in the application proposal of ethics. So in order to be appointed by the associate members, first is that the associate members must show that they are experienced and had actually handled a proposal at their faculty branch level and has gone through training as such that we are doing today. This is a prerequisite that need to be completed. So if associate members is interested, a new associate member is interested to join but has missed this dedicated training, then we are not able to appoint them as an associate members. Following the appointment, um, um, the associate members will then need to sign confidentiality form, which will be given by this, the secretary will deliver this to you. And be aware that the moment you are an associate member, you are an independent body. And if you have any conflict of interest with regards to becoming an associate members, or when you review the proposal, you must be able to identify that and declare, and then let us know about that. Okay, in case that you have to end your tenureship as associate member, please do let us know at least a month before, before the end date. Okay. So what is the scope and what is the role? So the role is actually to help the REC to assess the ethics application and see whether these actually goes into minimal risk, more than minimal risks, or can be exempted from the ethics approval. So how do you do this? We based it on the principles of ethics, which will be explained later throughout the day. Okay, so you will propose which category this fall into, and then you can propose whether this can be exempted. And then apart from that, you are also responsible to train people around you at the faculties, at the branch level about this information, so you can help and assess them, not assess, but to help them make the decision at the ERC level. Okay. And you also can become the ahli jawatan kuasa, what you call that, at ERC level, or jawatan kuasa penyelidikan. Okay. So typically the appointment is 2 years, and your appointment will be done by the TNCPI. So we do want to have associate members who are very proactive, helping us out, because there are so many applications now with regards to ethics proposal. Okay, let's just go through. So this is the 3 categories that the associate members will be trained today with regards to information, and later hands-on in the afternoon. So hopefully you have read through the proposal given and try to give your opinion and try to decide whether this one of the proposal falls into any of these 3, and then you can debate and discuss about it this afternoon. And right. So how do you decide? How do you go through to decide? Typically, these are the things that you'll be looking at the proposal with regards to ethics consideration. So you want to look at the study background, the rationale, what is the nature of the data. I think the title and objective is really important, and the methodology, how are they going to execute the procedures, what are their measuring tools. Look at the type of participants that will give you a clue whether this is going to be vulnerable or not, where the data will be collected, and what is the bank of the study, and how they handle the data, and how they store the data, the safety of the data. And other thing that you may want to look at, which you will be doing later in the afternoon, is look at the social and scientific value of the studies. Does it involve human being? We are ethics committee that review ethics proposal with regards to human participants, and whether the scientific validity actually follow the scientific principles. You want to make sure that the participants recruited is fair in all way during the recruitment, and also throughout the study participation. So you want to make sure that risk and benefit, you want to identify whether the risks outweigh the benefit, or is it balanced out, or the risk is very low within the proposal. And then you may want to see whether this proposal need to be reviewed by an independent review, meaning that this proposal is out of the context and expertise of the reviewer, and we may not be able to find any reviewer available within the members to review this proposal. So the secretariat will then inform the REC to raise regarding the need of independent reviewer from the outside, who will then review the proposal. They're not able to vote, but they will give their expert opinion regarding the categories. Okay, you also want to give a very specific attention to informed consent, and then looking at other ethics components with regard to potential and enrolled participant. Potentially, we're looking at the very early part where they're gonna assess based on inclusion and exclusion criteria. So other thing that you may want to consider in reviewing the ethic proposal is looking at the sensitivity of the questionnaire, whether it is sensitive or not, normal, is it touching on religions, sexuality, and other sensitive questions, whether they are using false leading questions. So you may want to give some comment on that. And then looking at the informed consent, this is again very important that it has to be as layperson as it can for the understanding of the participants, and to make sure that it is conveyed without too much jargon, and then it is age appropriate as well if underage is being recruited. Information with regards to confidentiality and anonymity is also important with regards to their study proposal. So these are the things that you may want to look at in their proposal, and then think hard about whether there's risks to the study participants, and then what are their mitigation plan to be certain that the importance information is being addressed. So typically, when you receive a proposal from the secretariat, you are given we have to adhere to a timeline. So it's 2 weeks, 2 weeks of within the working days. Then the secretariat won't be able to know whether you are on leave and whatnot. So if you do receive the application where you're on leave and you think that you're not able to meet up that 2 weeks deadline, please do respond quickly to the secretariat so they can identify other reviewer. But if you can, I mean, it is within your scope and you are able to do it even during your leave, please help us to review the proposal. The secretariat will typically give a reminder at the end of 1 week and then at the end of 2 weeks. Okay. So this is just a diagram looking at where the process of proposal. If you see, it's quite a long process. So students sometimes they get very frustrated. They think that their proposal application start earlier on, but actually not. So the review of the ethic proposal is actually at in the middle here. So it has to be processed earlier, and then we have to remember there is a post review process as well, because if there is correction, right? If there is correction, they still need to do the correction and get back to you with their correction, and for you to see if the correction was done accordingly. If not, it will have to go back to the PI for them to do the correction. So that goes in cycle. Okay, the faster it gets done, then the faster the PI will get a issuance letter. So proposal is very good. Will which have no correction to be done will then be verified by review very fast and then get the issuance letter. All in all, the process, we tell the researcher that you need to allocate around 2 months for the whole process. Okay. Sorry. Oops. Okay, this is the flow. So we are talking about minimal risks. Yeah. So where minimal risk, if you look at, I'm just gonna run through the timing. So if you see my cursor here, this is 2 weeks. Okay. The secretariat will then screen first because the application may not be complete, but this is the 2 weeks working days, yeah, that we really need your help to adhere to review. So these 2 weeks doesn't include the repetition. See, if there's so many correction, right, and then there's so many things that the PI will need to do, so the next cycle start 2 weeks. So 2 weeks and 2 weeks, yeah. Okay, the material is a little bit heavy, it's a bit slow on changing. Okay, this is the flow chart. In case, in the situation where you have identified that the application is more than minimal risks. So all application that is more than minimal risk, you see the yellow dotted line here is that the application will then be captured by the secretariat, and it is compulsory for it to be tabled in the REC meeting. So REC meeting happens once a month. We have the Takwim available online, so there'll be further delay for the applicants because they will need to wait for the date and present, and they may have to do more updates or correction following the full board meeting. Okay. So during this time, associate members who reviewed the application will be invited to join the meeting at the time when the student come to present for us to update us about what are the findings that you have identified from your review, and then review together during the meeting. Okay, now we go on to the undergraduate. Okay. Not undergraduate. Okay, this is the ecosystem. I think I tried to put things together, but this is the best that I can do. Before 2021, right, all the applications for research ethics goes through the research ethic committee. All right, so that include all application from the postgraduate, undergraduate, and so on. Okay, and when there is an increase in numbers in the research ethics proposal, because we are catering for the whole of UiTM, this is a mega university. So the associate members were being appointed to become the right hand to assess, together help the team to assess the ethics applications. Okay, so the next slide I want to show you about the increment of the numbers of the research ethics application. So this was in 2021. You can see there's a whopping increase, right? 2019, 745, and 2021 there was more than 3,000 applications. So at that point of time, there's just a lot of processes, because it's not about process, but it's also a post process. So that's when the ERC was established. Okay, a procedure was set up to establish ethic review committee who are given a mandate and responsibility to review ethic proposal with regards just to the undergraduates and also postgraduate with the coursework. So they're able to decide whether this is minimal risk, an exemption, or more than minimal risk, and give approval for minimal risks and exemption. But if they have identified that this is more than minimal risk, they will need to submit to our REC to be reviewed. So that review will then be submitted to either associate members or the full member to review. So this is basically kind of like a flow chart of where the ecosystem is. So we have REC, under which we have the full members and associate members, and we have ERC, which help to being given the mandate to look at the undergraduates and postgraduate by coursework. But the applications that is more than minimum race will still need to go through us. So just a small information about ERC. So ERC is an establishment which must have a minimum membership, which is 7, and must comprise of a chairperson, which is a member or associate members of a REC. A deputy also must be a member or associate members of the RECs. So you can become the chairperson at ERC or the deputy chairperson. It's even better because you know a lot more things and you can help to govern the ERC. And it must have at least 1 member or associate members and at least 2 academics or professionals who are with UiTM, at least 2 layperson who are UiTM employees. Okay. So the meetings who should be present should be 5 lah, although you have 7, but the meeting should be for enough quorum for the meeting to occur. A chairperson or deputy chairperson must be present, at least 1 member or associate member of the REC among that 5 quorum. Okay. So trainings, again, ERC, similar to associate members, are expected to update themselves with knowledge and skills, CMEs about ethics application, at least 1. It can be in the form of seminar, workshop. This can be considered as 1, or if you have attended somewhere outside by the WHO, so just submit, keep a certification of your completed attendance to be kept, because it is a requirement that is required by the term of reference. So you see, this is a term of reference highlighting that we're looking at the just undergraduate and postgraduate by coursework student only. And this is where the associate members role comes in. So you can act as the representative of the UiTM REC at the FERC or branch, faculty or branch, to make sure that the application form is complete, just to help to help along the members who are not familiar, right? To get for them to be familiarized. And you can also, as mentioned earlier, can become a members of the ERC. So going back to the ecosystem, this was back then before earlier 2021. So now we have this ERC who's helping us with minimal risk and also exemption of the undergraduates, as well as the postgraduate by coursework. But all more than minimal risk proposal identified at the ERC will be given to us, and we will run the review again, either by full member or associate members. So we have at the moment 32 established ERC, but we are still due to hear from some others ERC establishment. So those listed here, we will be contacting you again. So for you to nominate your ERC members for your establishment ESAP. Yeah? Please do call the secretariat. They are more than happy to help, because the reason is that starting this year, we are going to start our ERC audit visit, and which will continue the next 2 years to complete the 32 of the establishment. Okay. So this is just again just a flow chart. If you see that the proposal has gone through so many steps, right? From the secretariat at GPN, JPK, GPF, and then go through the applicants, and again be endorsed and then the secretariat then will have to put that together and only send to us to be processed. Okay, so the time is not short. It is complex, but it's actually looking at almost the same proposal. Yeah. Okay, this is where we are again. If you look at this ecosystem, secretariat is after all the initial research proposal assessment, this is where we are in terms of assessing the ethics proposals. Okay, and then don't forget about post-proposal assessment also. It also takes some time. Okay, so just to let you know that we have a system, R&D system, for which it is being used to process the postgraduate staff as well as others, okay, who wants to apply from outside. But we still have application outside the system, which the secretariat is handling manually via email, which is for exemption, RAC 11. Okay, and also all applications being pushed or received from ERC for more than minimal risks will also be handled outside the system via the email. Okay, so all the ERC related applications related here, okay, which will be Prof. Norzi Atun will go through each and every application forms later. Okay, so this is just the flow chart of the undergraduate and also postgraduate by coursework at ERC. So this is where the highlighted area where the associate members can help. So you look at, you can still be here within the ERC to help endorse and categorize, to help the team and support the team in categorizing the risks. You can also become a reviewer. So not just associate members, you can also be within the ERC and be reviewers for the ERCs. Who better can become a reviewer of other than associate members, because you're already trained and you know what to do. Okay, and of course, I highlighted here that more than minimal risk will have to be sent to us to be reviewed again. And yep, so that's the review process. At the ERC level, the timeline is half of what the timeline is for minimal risks, more than minimal risk, which is 7 days. Okay, just to show you all the strong dedicated secretariat we have here. Our head of the unit ethics and publication in RMC. So we are part under here for resources, support from TNCPI in RMC. Prof Yong has just ended his tenureship, but he's basically is the pemangku at the moment. So under him, we have the ethics subunit and we have the publication subunit. I would like to introduce you to the new members, our executive officer, Asri, as well as Amal. So they're here less than a month. So we are training them and they are very fast at picking up things. It's very complex to do. Gladfully know that they are able to handle that. And we have 2 clerks and we have our strong person here, Encik Hisham, who has been very tremendous tremendously contributing to the secretariat work as well. So what do the secretariat work do? It just doesn't want to change, isn't it? Yes. Okay. So we process and we handle the document pre, during, and post. Okay. So this is the REC meeting calendar in 2024. Before the end of the year, we will then advertise it in the website. This is to show that the increment number, even last year, there's an an increment of the total number of application you can see, and then we can only see that it will just increase over the years because of more awareness of people about ethics, as well as more work with regards to publication, grant acquisition, so more research will be done. Okay. The team also handle a lot of other activities with regards to increasing the awareness about ethics applications, processes among the public, staff, and UiTM students. So these are some of the drive done in last year. We also do training for the associate members, for the full members, and this year we are handling visits from the MPRA auditors. Okay, and this is a new task which will be done starting this year, to visit all the ERCs in stages to see the compliance to the term and reference. So these are the documents we used. Don't worry, no fret. You can have a look at all these documents available online on our website, and you can download it. You can also download all the application documents there, and you feel that you lost, just email the secretariat or give them a call. Okay. That would be all from me with regards to the roles and responsibility of the associate members. Thank you very much.
Thank you, Dr. Hasno, for a very informative talk. The next talk will be at 9:30, so we have like 8 minutes left. Perhaps Dr. Hasno would entertain some live questions. Is that okay with you?
Can, yes.
Yes. So
If you have any question,
yeah.
we have a few minutes to spare. Any question at all?
Assalamualaikum.
Waalaikumsalam.
Assalamualaikum. Yes.
Saya nak tanya, untuk peringkat fakulti, untuk kita bagi kelulusan untuk adakah kita perlu untuk diorang present?
Present di mana tu, doktor?
Present di peringkat fakulti untuk postgrad, ataupun cukup untuk dengan hanya evaluate the proposal.
Ini berkataan ERC ke? Kelulusan di peringkat ERC. Betul.
Di peringkat fakulti. Ya, betul.
Fakulti. ERC Okay. Dr. Hasno mungkin nak jawab dulu.
Ya, saya cuba. So application is a lot kan, dari segi ERC saya rasa undergraduate, and it's come in lump. So majority I think if it is the research is typically simple, so it can, if the ERC govern in such a way that all application you send to the reviewer, because to begin with they are simple proposal, okay, that it would be, I think, more practical. But if at any review, during the review of proposal, and you feel that, oh, this proposal is a bit unclear, or not sure whether these actually fall within the minimum rates or more than minimum rates, you're not sure to decide yet, and you don't really want to send it to our side because you need more information than from the student, then you may want to call that for presentations at the ERC levels. But again, I think at the end of the day, it's how the ERC govern lah, I think. I will check with Hisham. Is that correct?
Yes, Dr. Hasno, you are correct. Sure.
Or any ERC chairperson here or deputy chair that can give some more insight on that?
Boleh, Dr. Hasno, maybe I can add.
Thank you.
Okay, at my faculty level, what I did, because the students basically, they are master by dissertation, yeah. So meaning that they will attend their classes at the same time, research methodology class, where they will develop the proposal, and at the end of the semester, usually we have our internal panels will look into their presentation. So that is sufficient enough for us to say that, it has been presented at the faculty level. Thank you.
Thank you so much. Yes, Prof. Rohana?
Perhaps we can share our experience juga Kasno from Fakulti Perubatan. I think for us particularly, we are concerned obviously of the ethical issues among our students. So that should not stop you from having an actual presentation. I think it's easy because sometimes what's written on the paper may not be reflective what they're actually doing. So it's usually useful for us to give them the opportunity to explain it so that they can we have more clarity to be fair to both sides. But bearing in mind that the objective is to maintain, because at ERC level, we are not yet discussing about the actual ethical issue, just basically, just looking through it at a bird's eye level. So then when you decide, the main thing is to decide whether it needs a full board presentation or not at the REC level.
Okay. Thank you, Prof. Any other input from other ERC, perhaps? So I guess if the application is quite clear, right, and been reviewed without presentation, clear with regards to the proposal, the method, and so on, and the ethical consideration within the proposal is okay and considered as has been presented. But it is also good for it to be presented as well. You have to consider, because what's written in the proposal may not be the same as what is being intended to be done. Okay. I would welcome one more question.
Yep.
Kenga,
Maybe
Cik
one
Syam?
more question. Yes, one more question. 3 minutes left.
We have all the big seafoods here in the top management as well within the faculty, ERCs, RECs. So this is the best platform if you want to raise your concern or question that you always want to ask or clarification. They are here to answer, to help us answer.
I think
Okay.
all of them understood well. Just to share with you that something that I forgot to share during the briefing earlier, but we've shared through our invitation. All of you will be asked to complete an evaluation form, an assessment where we will sort of like assess your understanding regarding what is being taught today lah. So just bear in mind, yeah. Okay, so maybe we can proceed to the next talk. Prof. Rohana and Dr. Dalile, are you ready? Yeah, there's a thumbs up. So without further ado, first I would like to thank Dr. Hasno for your marvelous talk again. So I'll pass this to Prof. Rohana. The floor is yours. You can
Okay.
unmute. Yeah. Yeah, Prof. Rohana, you can unmute. Yeah, we can't hear you.
Okay, now I understand why Kasno was struggling, because suddenly I couldn't find the button.
It's okay. It happens to everyone. Don't worry.
Yeah, seriously, it has
It becomes
disappeared
slow,
from my
Prof.
screen. Yeah, it becomes suddenly small. I'm struggling. Oh, what am I doing? Okay, hang on a minute. Assalamualaikum and a very good morning, everyone. I'd like to pengurusi mesyuarat Prof. Dr. Raymond, if he's still around. Dr. Hasno sebagai the newly appointed REC main person. Pengurusi Majlis, Hisham, and also Secretariat. Thank you so much for the invitation for me to be here to share some of my knowledge. Saya meminta kebenaran bercakap dalam bahasa Inggeris. All right, so the topic given to me, and let me just minimize this window. I don't know how to do this really. Right, okay. The topic given to me today is how to determine the categories of review, and I encourage you to ask to perhaps clarify if there's any confusion, because it's a bit heavy and it's a bit it's a dry subject. So, and because you have apparently some assessment questions at the end, so I encourage you to ask me if you're not very clear on what we're presenting today, Prof. Dalili should also be on board, I think. Right, so I'm going to start here. I'd like to acknowledge the contribution to these slides. These slides were given to me, and I will try to expand on them accordingly. This is our discourse. The research ethics review includes policy, purpose, approach, and the guiding principles, and the preliminary determinations that is imbued, I suppose, in this whole process, including research requiring which type of research it requires ethics review. The main thing I think message that I'm to convey today is the classification of the risk and the categories of the risk. And eventually is the determination of type of review, including the full board review, which we mainly talk about, and as well as that the minimal risk, which is exempted from review, and total exemption from ethics review at all. So just as an introduction, that this ethics research ethics review disdasar dan garis panduan telah dibintangkan oleh Institut Pengurusan Pendidikan dan Inovasi IRMI kepada mesyuarat Senat ke-242 UiTM iaitu pada 12 Februari 2019 dan telah mendapat kelulusan serta pelaksanaannya pada perkara berbangkit pada 9 Mei tahun yang sama. Dan selaras dengan piawai global, polisi ini bertujuan untuk memperkasakan agenda penyelidikan UiTM dan memastikan bahawa semua penyelidikan yang melibatkan manusia. So the keyword here is yang melibatkan manusia yang dijalankan oleh ahli akademik di UiTM dan pelajar UiTM adalah mendapatkan kelulusan etika penyelidikan sebelum ianya dijalankan. So basically, just to highlight to all of you that this has gone through a very robust and strenuous processes to verify what we are doing today. So the research ethics review, and for all of you who are, kind of wondering why we have to go through this very stringent process, is basically the purpose, the main objective that Nawaitu is to promote the ethically sound research, which protects the rights, the interests, and well-being of research participants. We used to have these slides on how this came about, how the research in the early days used to, just utilize humans as research participants without with due regards to their safety and well-being in the name of pursuit of knowledge. So this is why our committees such as ourselves and as well as all the other research ethics committees out there, we strive to do this. Our main aim is to really scrutinize the rights and interests of our research participants. But not only that, as well as that, we also would like to be able to scrutinize the interests and the safety of our researchers, as well as also protecting the rights of the research institutions. And that's the reason why it is a very strenuous process. It's a very intricate process that we look at every single documents that's presented to us to make sure that we maintain these processes. So a proportionate approach in reviewing the application for ethics approval from the researchers strikes, and we hope to strike a balance between this. When we try to assess the risks, as I had mentioned earlier, towards the research patients as well as the researchers and the institution, but also bearing in mind because without research, without new research, there is no new knowledge. And we always strive to also understand that so that we are fair to both parties, those who are seeking the new knowledge and those who are being studied to do so that we can basically strike a balance between achieving that fair and equitable benefit sharing approach, and also then be able to tell and be transparent that there is no conflict of interest, there is no hidden agenda around it. So therefore, the ethical review process also involves a very, very precautionary approach. So when our researchers argue to say that, oh, nothing is going to happen to the patients, and this is when we try to make them understand that, yes, we are hoping that nothing will happen to the patients or the participants rather, but we can only anticipate that things will not happen because it's not good enough to wait and see that it will happen and then only to say, oops, it happened. So that's the reason why, researchers, there's an argument between what can be done and what can't be done. So that's basically the whole process. See, these are some of the guiding principles that we that explains to you. I understand. I'm sure you are also frustrated with the number of REC forms out there. So just to kind of highlight to you that these are some of the guidelines. So it's not something that we pluck out of the sky. These are some of the documents that we have used, and we have had multiple workshops. I think Asno is not involved in many of them. However, I can assure you that we had gone through many workshops to actually develop these documents. And these are some of the guiding principles. So, for example, ethical standards and procedures with our the research the ethics review board also takes into account cultural values as well as local practices. So the informed consent that we use to obtain from the potential research participants, that's REC4 with the consent form and REC12 for the assent form, which is for those below the age of 18, so which and also those requiring guardians. The risk of harm to participants are assessed and minimized by the REC4, which evaluates research risk. Anonymity and confidentiality of research participants are to be protected, and this really revolves around confidentiality, and this is again assessed by REC4 form. Then there is absolutely should not be any deceptive practice in terms of data collection, meaning has to be transparent, and patients or participants rather needs to be fully aware of what they're getting into. And finally, REC4 basically covers all of them to maintain the concept of voluntarism in participants, that they have the absolute right, the ultimate right to withdraw from the research, and they should not be treated unfairly if they decide to do so. So the research requiring ethics review, and this was what was developed very early on, is basically to be clear in what is required, when do research require REC or ethics review review process. Number one is human participants. So as long as you have human participants, they have to go through ethics review. And this can be in the form of multiple as listed here, not exclusively, inclusively, but not exhaustive of this list. Interviews, focus group surveys, action research. Of course, starting from below is the intervention study, clinical trials, but as well as observation and case studies. And the use of human body as well, any parts of the human body, including human cells, human genomes, tissues, organs, and body fluids. So that's why researchers also wonder about why they need to go through ethics review when they're using secondary data. But anything to do with the human, anything derivative from the human body has to go through the ethics review. And as well as that, research with potential risks on human. Yes, anyone? Okay, research with potential risks on human, and that could be in any form, either it's physical, and that is most that we are confronted with, but as well as that psychological, socio-economic, any potential risk to participants' privacy, confidentiality, and that's why Prof. Dalili is here, and that is with any legal threat, and that could be considered as potential risk. Okay. So moving on, the classification of risks should actually from different angles, if you want to look at it. Number one is from the participant profile. So age is an easy determinant. So anyone under the age of 18, they are considered non-adults, so they are at risk. Participants from a particular vulnerable group, meaning they can be vulnerable in any form, physical incapability, psychological, emotional vulnerability, and even school children, for example. Yeah, if you can keep your mic muted, please. That will be very useful for me. Anyway, so patients with particular, including those with institutionalized. So that's what I'll give you a few more examples after this. Participants in terminal care, and that applies to us in the clinical setting. Participants unable or incapable of giving consent, and participants who are given emolument. So this is up to discussion, because most of our participants are given emolument to participate, and obviously that's for some definite reason. So you feel free to have a discussion on this later. As well as that, risk arising from privacy and confidentiality. So data collected which have the potential to cause discomfort, embarrassment, or psychological harm to participants. We had to go through a very stringent process of ethics review at the Ministry of Health one time when we were doing a health screening project involving the Ministry of Health staff. So that is because they were very clear from the beginning. They were not sure about, they're not even sure what the results were. But because of that uncertainty, they had to go through the stringent process of having to review what if the results were embarrassing to the ministry, for example, and others. Research involving undeclared methods of data collection. So, for example, any parts of the body which is thought to be discarded, but if it is going to be used as part of research, that again should undergo that stringent process. And data to be made available to other parties who are not involved in research. And this does not include sponsors, auditors, or anyone who involved in research. This is completely a third party that is not relevant or not related to the research at hand. Risks arising from physical activities are actually quite straightforward, I think. So research collects biological samples, including body fluids, collection methods which are invasive. Perhaps Dr. Tengku Intan minta tolong mute boleh? Or someone can mute Dr. Tengku Intan for me? Quite distracting. Dr. Tengku Intan. Right, thank you. So risk arising from physical activities, collection, okay, so research collects from biological samples, collection methods which are invasive. So we consider blood taking as minimal risk, but to lay people may not be so. So other than that, we've always had this discussion about when research came from some sports, from the faculty of sports, for example, that vigorous physical tests their daily routine, for example, but we consider it as a risk when you're implementing it on people who never exercise or occasionally exercise like me. Participants who with chronic illness, participants who are subjected to maximal exercise intensity, data collection which involves clinical procedures and medications, and unapproved drug or device. So again, this is up for discussion later, and I will elaborate this in a bit later on.
They don't care if they are not corresponding. Actually,
Okay, so Dr.
prefer
Tengku
it. For me,
Intan
I
seems to
prefer
be
it
in a
for the
very serious
corresponding
discussion. Dr. Tengku
with
Intan,
the
can I ask you to mute yourself,
system.
please?
Yeah, so I'll be very happy.
Hisham. Thank you. All right, people who are less, okay, so the vulnerable group that I was kind of glossing through earlier includes some of these groups as well. So again, this list is not exhaustive. These are some of the examples, and these are the ones that we commonly encounter. So a person with poor health or with mental or cognitive impairment, unable to actually understand what the research protocol is about. So they are not able to give a full informed consent. A person who is too young to legally consent, so that's why we have the assent forms. A person of minority status, so for example, foreign workers or refugee who feel some level of coercion or some level of that they are being pressured to participate, because if they don't, then they're going to be deported back, for example. A person in a dependent relationship with the researcher. So again, this is up for discussion because, for example, as a clinician, I would like to invite my patients to participate in the study. If I feel that I'm trying to talk over Dr. Tengku Intan. So a person, for example, my patient, if I believe, Hisham, would you mind?
So this is how you do networking collaboration 101. Not the
Okay. So a person, for example, my patients, I would like to, if I believe what in the study, I would actually like to invite my patients to participate because I think it may benefit them. But on the other hand, they will feel pressured to join the study. So this is where it is very, very important for me to explain that I think this might benefit you, but there is a placebo arm, for example. You may not get the active arm, and I will not hold this against you if you do not want to participate. So the informed consent process is very, very important to do. So it's not really that I can't invite my patients to participate. Okay, so the other vulnerable group include those who are very old, so very young and very old. So babies, very few studies as clinical studies because it's so difficult, and we're so scared that it involve this very, very vulnerable group of patients. But at the same time, in the pursuit of knowledge, there are certain things that we need to find out. So if that is so, that you have to be very, very, very clear that the benefit really offsets the risk in this group of patients. And also those with very, very old, more than 65, those with weak immune system, those suffering chronic illness, those in childcare or nursing home, and pregnant women. I can tell you that it's very, very difficult to do a study in pregnancy because again, you have double whammy. You don't know whether the risk is to the mother as well as to the children. Okay, sorry. Just gonna go on. Right. All right. So therefore, does that mean that you cannot do any study on them? No, absolutely not. You can actually do studies on them, but that is when the ethics review committee have to play a very big role in assessing, making sure that the benefit really, really, really outweighs the risk by 10 times. I know it's not just very small. So in the research with vulnerable group, it's justified if the priorities over the benefit, the priorities of the benefit really offsets the risk in these patients. And the vulnerable group must also stand to benefit from them. And it's not just therefore just because a lot of the times when we do research, it's for future knowledge, right? So it's for future patients. But for these vulnerable groups, we must also try and strive and aspire to make sure that this research group also benefit from the research results. Okay. So so therefore, ladies and gentlemen, we come to this. So minimal risk, more than minimal risk, and exempted risk. When do these happen? So those I'm going to start from the middle because that's the easiest probably. That the probability and magnitude of possible harms anticipated by the participation in the research is greater than those encountered in everyday life. So I like to give, because I'm an endocrinologist, I usually like to give an example of revolves around diabetes, for example. Okay, so if my standard treatment is is what I give every day, so treatment is definitely more than minimal risk because I'm giving new treatment. And as you know, in diabetes, it's evolving so fast. There's so many new medications in diabetes. Okay, so in that, for sure, most of my patients are more than minimal risk. Okay, so therefore the process is it has to be it firstly has to be reviewed among the REC members, and then the review is presented at the full board. Okay, so simple. On the left hand side is if it's minimal risk. So minimal risk is when the probability and magnitude of the possible harms anticipated by the participation in the research is no greater than those ordinarily encountered in the daily life. So for example, I've got intervention studies that looks at diet. Okay, so I'm going to give you into two groups. One observes the low carbohydrate diet. The other one, eat as per what you want. Okay, so you will want to be in the eat as you want group. But those in the low carb group, for example, okay, so this is probably if it just requires, so I'm just going to tickle your brain a little bit. If the intervention group is basically just observing how you eat. So for example, your level of binge eating, for example. So that can easily be construed as nothing of the ordinary. I'm just going to observe you, okay? However, if I'm going to prescribe to you to say you got to eat very, very little rice, you're going to feel really lousy, okay, because you don't have sugar, for example, okay? You're going to feel depressed because you can't eat anything. So that is definitely more than minimal risk, okay? So anything out of ordinary, so for example, I'm just observing how you eat, how long you take to chew your food, for example, okay? I'm just going to observe that in terms of timing. So that can go into minimal risk. Anything which is within your daily life, okay? Right, so that's quite simple that way. Right, exempted risk, less than normal risk, is when whatever research involves risk-free or nominal risk of harms. Example, that if I were to say to you that I want you to read this book, okay, this book on diabetes, I'm going to give you 10 days to read this book on diabetes. And then after that, I'm just going to give you a questionnaire to assess how happy you are after you read the book. So before you read the book, after you read the book. Okay, so this is on top of my head, just an example. So that can be considered as an exempted risk. So what is the review? So on the left-hand side, so we still review it. We review it as minimal risk, and then we basically write to you and say, okay, you're okay with minimal risk. On the other hand, on the right-hand side with the light green, exempt those if your research fits into that description of a very less than normal risk. You only need to fill in the REC 11 form, and this would include the risk of data collection not related to research activities, It's still reviewed, and then once the members agree or the secretariat agrees, all right, it doesn't look that harmful, then it can be exempted from further ethical review. Okay, so generally that's how we classify it. So risk arising from participant profile, this is from the minimal risk. This is actually minimal risk. That research does not, but for us to consider it either as exempted review or minimal risk with or without exempted review, then research does not involve the vulnerable population, because the moment it involves vulnerable population, it goes to more than minimal risk. It is a non-interventional research, okay? So the moment it becomes interventional, it's more than minimal. And then those who are only required, if you are using survey and questionnaire, that can be exempted or even minimal risk, but it has to be of a topic which is not sensitive. So some of the researchers use, for example, the use of, we've had a few, for example, just on top of my head, the use of condom among students, for example. So that's a very sensitive issue. So it cannot be minimal risk. Okay. So risk arising from privacy and confidentiality, research in which involves anonymous or unidentifiable data, so that can be exempted. Research does not that does not involve the collection of stigmatizing information or sensitive questions I mentioned above. Okay, and finally, in terms of physical activity, the research should not pose any risk which is above expected in daily life. So, for example, once there is blood throwing, once there is physical examination, we kind of like still have to go through and make sure there is not more than minimal risk. Okay. So the full board review, I suppose I wanted to simplify it as everything else, but anyway, so just to delve it into a little bit, that risk arising from patient profile would include the research that involves clinical trials of new drugs, new treatment or procedure. So by that, I do mean also that even if it's available in Europe, say, but it's not available yet in Malaysia, so that's considered as a new drug, okay? Research which involves randomized controlled trial and intervention, definitely full board. Research which involves questionnaires or survey, which is within vulnerable group, but also questionnaires and surveys which are sensitive, which has the ability to or the potential to cause a bit of harm in terms of psychological, for example. Risks arising from privacy and confidentiality, including genetic and genomic studies, because we're not very sure. Even now, some of us do a lot of genetic and genomic studies, but the application of these results are currently blurred. So we're not very sure about it yet. So online survey that requires participants' email address to be disclosed, so that can be more than minimal risk as well, because that violates confidentiality and privacy. And finally, research from physical activity, which is research to be carried out in an unstable or volatile setting. So I've got some examples a bit later on. Research which requires traveling or taking place in high-risk locations, or those with travel warning issues. Research presents risk to the personal safety of the researcher or research participant beyond what is normal in the setting. Research involves non-standard methodologies or approaches. So for example, even if the method is standard for one procedure, but it's not so standard for another procedure, that is considered more than minimal risk as well. And research that possibly causes distress on the researcher or research participant in one or more ways. Okay. So these are some of the more than minimal risk research. Again, some listed here, not exhaustive. Research involving potentially vulnerable, I think I've repeated that many times, sensitive topics that may cause psychological stress, anxiety, or humiliation. So even some of our students who used questionnaires or psychological questionnaires, there's always that question to the students, that if any of the participants go through the psychological questionnaires, for example, on trauma, okay, will it evoke new emotional response? So some of these things also, which is, that we have to evaluate. Research involving potentially sensitive topics, example, sexual illegal behavior, especially now in the current era when there's a lot of LGBTQ activities which is not yet legal in Malaysia. So such research are actually quite sensitive for us, for students to, or for researchers. Intrusive interventions or data collection methods such as administration of substances, and this would also include Supplements, okay, so supplements consumed orally, again, this would be considered as an intervention. Research where the safety of the researcher may be in question. So, for example, they're doing a new procedure that is using a new chemical that we're not sure what it is, so things like that. And research involving respondents through the internet where visual images are used and where sensitive issues are discussed, especially, example, again, I'm just giving an example on top of my head, some of the experiences we've had on pedophiles, for example, so again, this would be quite more than minimal risk research, and any research where biological samples are collected and or medical imaging techniques are used. So these are some of the phone call now. Right. Some of the, again, this is the European Commission Ethics in Social Science and Humanities Research Checklist for higher risk research. And I'm not going to read it here, but some of it I mentioned before, but just a few that I want to highlight. So conflict regions, for example, sites of historical value to indigenous people. So these are some of the research that we try to, although some of you may say it's important, this is new knowledge. Yes, it can be done, but still it has to be some. So these are things that we have to really scrutinize. Sensitive areas of research, risk of exposure to harm to participants and to researchers, potentially sensitive topics. Okay, so, and as well as data collection and processing to be implemented. And finally, if I can bring your attention to the final line, which is the potential for misuse of findings. So what is the use of this? What is the use of this knowledge, new knowledge that you have collected? So this is another things that, some of the other things that ethics review have to say. Okay, so what are kind of research that has exemption? Research does not involve humans. Okay, so by that I mean, okay, for example, if the research, which I find quite also perplexing, when we used to review research involving, I don't know, something like trees, for example. Okay, ladies and gentlemen, just again to tickle your brain. Okay, I was wondering, why does this research have to go through ethics review? Because if you remember what we started off with, that although the research does not involve human participants, but if it involves human researchers going out there and putting themselves at risk, I suppose the faculty has the right to decide whether you want to go through the ethics review or not, okay? And that is to safeguard your researchers. But originally, the ethics review process involves human participants. Okay, so I suppose so. Again, you can argue on this. Oh, so anyway, so however, if you want to go through the ethics review committee, because I think a lot of publications, a lot of what is it? A lot of journals now require ethics review. So that can be also submitted and it can go through the exemption process of the REC. Okay. So case studies, doctrinal study, policy study. So some of the journals ask for case studies. So you can have like I don't know, 10, 12 case studies on certain patients. So that one do not have to be presented. It can be, you can just apply for exemption. And observational studies based on video recording obtained from public domains that do not collect sensitive or identifiable data of an individual, that can also be applied for exemption. Research that does not collect identified or unidentified personal data. So secondary data. So for example, some of our pathologists use a lot of secondary data from specimens, discarded specimens. Yes, they can also submit to the REC to get exemption for this. And personal data means any information that relates directly or even indirectly to a data subject, identified or identifiable from that information. And sensitive personal data also carries the personal data consisting of information on the physical or mental health or condition of a data subject. Okay, or any other personal opinions of his or hers. And non-research activities include involving humans. So any market survey, opinion polls, online votes, consumer awareness and acceptability are to be exempted. Okay. Data collection for quality assurance purposes, including MQA audit, INCA audit, compliance audit. Audits generally do not have to go through REC. However, most of the journals, as I said, also require ethics approval nowadays. I don't know what journals that you subscribe to, but some of them do that. So if your journal is asking for ethics review and ethics approval, then you can also submit to REC, and this is the process you'll be going through, which is exemption from ethics review. And finally, is on the documentary, photographing, recording, filming of real events, cultural, traditional practices. Again, when it comes to publication, that is when ethics approval is required. Okay, so that brings me to the final 15 minutes in case anyone wants to question me. Back to you, Hisham.
Prof,
Thank
can
you,
I
Prof.
ask a
Farhana.
question?
Yes, go ahead.
All right. My name is Shadin. I'm from Faculty of Sports Science and Recreation. So Prof. Rohana, I have a question in mind, yeah. So
Yes.
I would assume anything that's invasive would be more than minimal risk, kan?
Correct. Yes, correct.
So, what about finger prick, eh?
Is that all? Finger prick?
Finger prick, yes, where you take blood from the finger,
Okay.
just pinch, macam yang
Right.
kecil itu je.
Okay. All right. So thank you very much for your question. A very relevant question. A clinician as yourself. For us, okay, because our patients, and that is so good because you relate to diabetic, which is my area. So for us, patients take pinprick all the time, right? So
300.
okay. 300 apa tu Nurhaliza? But anyway, so my patients take pinprick all the time. So for me, for us, it is considered as part of part of everyday practice. So that therefore should be considered as minimal risk lah. Okay, that's the usual. But if it is to, I suppose, so it boils down to that. However, if you're going to do this in among children, for example, yeah, right, even among adolescents below the age of 18, so it can no longer be minimal risk.
Got it.
Mm.
And on that note as well, okay, finger prick is considered minimal risk. What if a researcher conducts a single session and within that session measuring with the finger prick at 5 different time points within the session? Is that still minimal risk? Because it can be quite bloody juga at times.
Yes. Yes. No, it's not. Then it becomes different. Because what are you assessing during that time? For 5-2, what are you assessing? Is it an
Blood
intervention?
lactate. Yeah.
Is that intervention?
Yes.
So it becomes yes. So the discomfort too becomes escalated or becomes aggravated, right? So it will no longer be considered minimal risk.
Got it.
And
Thank you
also
so much, Prof.
because for those two things, that also because you're doing an intervention, so then definitely it cannot be minimal risk already.
All right. Perfect. Thank you.
You're welcome. Any other questions?
We have several questions, Prof.
Oh, do you? Oh,
the
sorry,
chat
from the
box.
chat. Okay. Disturbing sound, can't focus. Sorry, disturbing. Remove please. Sorry, apologies.
Hisham nak bacakan ke macam mana?
Okay. Research involving minor. Example, observations involving children under the care of private government kindergartens. Do we advise the applicants to get the approval from the kindergartens formally via letters, email before sending the forms to ERC or after getting the approval from ERC? Chicken egg situation. I would say first and foremost, you have a sound approval first, because that will determine whether you can carry out the study or not. Once you have the sound approval, okay, so that's you've evaluated, and we think that it's non-harmful to the children, blah blah blah. Then you can approach the kindergartens because your choices are bigger. We're getting the different kindergartens. Because if you can't get this one, then you can go on to the next one and the next one. So yeah, because if I'm running the kindergarten also, I would want to make sure that your research is sound and has been approved by your ethics committee of your institution. Okay. 2 questions. Non-interventional cost of an illness, children, hence vulnerable, from a societal perspective, where we collect cost data from patients or caregivers, can it fall under exempted review? Okay, let me just digest that. Non-interventional cost of an illness from a societal perspective, where we collect cost data from patients. Okay. Yes. Okay. Right. So it's essentially, if you look at it and you present it in a way like an audit. So you can tell Dr. Kasno, we're not going to touch the patient. We're just going to collect the data. We're not going to reveal the name of the patients. They're just going to be marked by A, B, C, D, E. then it can be under exempted review. And I will support your application for exempted review. Okay. Where do we draw the line on emolument for participants? Okay. The emolument, okay, oh yeah, I forgot to talk about that. Our patients receive emoluments all the time, and we call it honorarium, and we say for transport. Okay, because for example, our patients can be, we are based in Sungai Buloh, our patients can be from Rawang. It can take 40 ringgit, 45 ringgit for them to come. Some of them weekly visits for the first 4 visits. So that's a lot of money for them. So we pay them, initially we pay them 100 ringgit. That was 10 years ago. And then it became 150 ringgit. And then it became 200. And now it's 250, for example, because it's balik, pergi balik, right? And then the Grab driver, Grab becomes more expensive. So I suppose you draw the line to say what you agree to be non-excessive. So for example, we say 50 ringgit. And then we say pergi 50 ringgit, balik 50 ringgit. So 100 ringgit. And then we say, if they don't, if they were to work for Grab, lah katalah, how much are they going to earn within that 1 hour? So basically, it's for us to compensate. But if one trip, we give them 500 ringgit, so that is a bit too excessive, okay? So what you consider, and then it's up to the REC members to also evaluate this, and you justify to say this is what we think is reasonable, and REC members ultimately can agree or give you other suggestions on how much the amount is. Okay. Right. If the participants are given educational materials, and I suppose in a way, finally is something that you want to give, an amount you want to give that a patient can refuse. Okay, kalau you bagi, kata dia bagi 1,000 ringgit. Okay, patient datang 1,000 ringgit kalau you datang ni. So it's an amount that the patient unfortunately will not be able to refuse. So that is probably where it becomes a bit the question mark about how ethical it is. Okay. If participants are given educational material in which stated that drugs they are taking have side effects which they are not aware about it before this. Okay. Okay, first and foremost. Oh, okay. They're only given educational materials on the drugs. Okay, so if it's only on, the intervention is only on educational material, yes, it is a minimal risk. It might create anxiety or concerns. Yes, that is correct. But you have to be also accountable on how accurate that information you are providing on the educational material. Because if katalah you provide this and then the company says that that's not true, what is your evidence to do this? And you cannot protect it, you cannot support your claims, then you will be in trouble lah. Okay, so if you were to submit this to REC, then we will have a look at the educational material and we will ask you, do you have enough material to support this? If you can justify, okay, go ahead, but you have to be ready if the company decides to sue you lah for it. Okay, but it can be considered as minimal risk. Not an issue, because we are very we should be, if our concern is the patient and the patient should know about the side effects, then it should not be a problem. Okay. Regarding getting approval, it should not be a problem as minimal risk. However, if you have any blood taking then it doesn't become minimal risk. Okay. Regarding getting approval or permission from other institutions first before applying ethics at UiTM, is okay, all right. It's better to get ethics or ethics approval first, and the applicant can approach outside institution better with approval. We do things necessary. Hisham, that's your answer. Is it your answer?
Yeah, exactly same with you. You clarified it better. Thank you, Prof.
Okay, so this is Hisham. Okay. Assalamualaikum. Is it feasible to offer a fundamental foundation outlining the characteristics and guidelines essential for evaluating the proposal concerning the measurement of psychological stress emotional levels? These are requirements for a medical research model to serve as the basis for assessing these levels. I appreciate having it. Okay. Okay, Hisham, can you answer this? Fundamental foundation outlining the characteristics and guidelines essential for evaluating the proposal concerning the measurement.
I was about to write. I think it's quite technical for psychological proposal or any other proposal. You need to seek advice from the expert from the field. We advise on ethical level, and while we advise, while we teach on that, we still refer each different like proposal to the expert. So I
But
think
she's
for this,
asking, but she's asking
which-
from an
yeah,
angle
perhaps,
of the evaluator.
yeah. So
So,
perhaps
may we
you,
take note of this, Shaira?
yeah,
We take note of this. We will go back to Prof. Salmi maybe to discuss this,
betul,
whether we can
betul.
provide you the outline.
Yeah.
Okay.
True.
I think it will be useful as well. But have I lost everybody?
Yeah, you're back. You're back.
Okay.
Yes,
As Hisham said, everything is a bit neat, but we can try
yep.
to give you an outline on what it means to be psychological stress and emotional stress. Okay. UiTM Perlis. Okay. Musim harum manis tak sekarang? Belum start lagi. Saya nak reconfirm procedure bagi UG untuk decision MMR. Adakah proceed ke sistem red atau akan diselesaikan di peringkat ERC? Syam?
Yeah. So it's kalau MMR is always us. So forward it to us and apply via RED system. Yes.
Okay. Non-human identifiable, but organization labels as privacy confidential via NDA. Does this require non-human organization labels as privacy? I probably need to clarify, Jasbir. What do you mean by organization labels as privacy confidential?
Yeah, Prof, good morning. Yeah.
Morning.
Okay, we have research where data is in a secondary data set from organizations and various institutions. However, some of this data where PI is required to sign some kind of non-disclosure agreement whereby the data cannot be shared to others. It's just solely to be used by the researcher. So in such a case, where the data is deemed to be private and confidential, will the research still qualify as exemption?
Okay, we generally have to look at your objective, okay? Because secondary data doesn't necessarily automatically goes to exemption. We need to look at the objective of your study and the methodology. It's either exemption or minimal risk, either one. Most unlikely you'll not be presenting a full board lah.
Okay.
So exemption or minimal risk is essentially the process is similar because we just go through the reviewers. Yeah, but we need to look at what is the objective of this data collection.
All right. Okay. At CERC level, there are cases where such a scenario we approve it as minimal risk. Now, the next question arises is that what happens to the consent form? Because if minimal risk, they are required to fill in ERC 1. And how about ERC 2, the consent form? What happens to that?
Consent form really applies to what kind of study you're doing. So if you are if it involves any human participant, then your informed consent is relevant.
Okay,
Can
now
I give you an example?
because like this now data from organization where there
Okay,
is
this one, same one.
Yes.
Okay.
So does it still qualifies? Let's say it goes through a minimal risk, so the PI will fill in ERC 1. So what happens to the ERC 2 then? Because data is from organization.
Okay, so you're referring to the same
Yeah, the same case.
Then you don't need you just put it's non-applicable.
Okay, all right. I just need, I want to ask another question. Okay, now suppose there is already a research which has already been granted for approval for more than minimal risk. That means research data collection already completed. Now the researcher would want to share the data set on an open platform so that it's accessible for other researchers. Now, the nature of data is on mental, social media mental patients. But the researcher has promised to remove all human identifiable, the participant identifiable variables.
Okay.
So is that permitted, or does the researcher need to write into REC for that purpose?
Okay, hang on. So the data collection was for the purpose of the research, yes?
Yes, correct.
Okay. So if that is so, yes, you just have to inform REC that you will be making this available online. Because that if katalah for example, you are talking about the initial example that you gave about the secondary data.
Yeah.
The data was collected not for the purpose of research. It was collected for something else, and then you used it as secondary data, betul?
Yes, correct.
So for that one, it depends on the owner of the data to decide what you want to do with it. You want to put it online, you want to keep it up to the owner of that database lah. Okay, the data set. But for this research, if you collected the data for the purpose of that research, which has gone through REC, and then you decide to put it online, then you need to inform REC that you're doing that. Okay, but more importantly, I think is that you need to inform your dekan lah, because it belongs to the institution. Data belongs to the institution.
Okay, because this is a PhD candidate, so so the best is to inform dekan IPSIS or
Your dekan first.
dekan, okay.
Dekan faculty, because the data belongs to your faculty kan.
Correct, yes.
So that one first. The institution gives consent for you to put it online. REC, you can inform lah, but it will not go through the evaluation process of REC because that's really not really within the jurisdiction of REC. I should think so.
All right. Okay. Thank you, Prof.
Okay. Elderly age is stated at more than 65. Oh no, I've gone beyond time. Sorry, I'm finished.
So okay, thank you very much, Prof. Rohana. I think the discussion has been quite very, very active, I think. Thank you for your participation.
Thank you so much for your questions.
answer.
Yep.
Yep.
I'll just answer the rest online. Thank
Yep.
you.
Thank you, Prof. Rohana, for that. So again, thank you for a very informative and very engaging talk by Prof. Rohana from Faculty of Medicine. Much appreciated. Without further ado, I would like to invite Dr. Aimi for the next stop.
Assalamualaikum.
Waalaikumsalam. Thank you, Dr. Aimi. So the floor is yours. Yeah,
Good
you can
morning.
share your presentation. Okay, we can see
So I'm
you.
going to use two devices. Can you hear me well?
Yes, Dr. Aimi.
Okay, Alhamdulillah. Alright, I'm just going to share you in another device about computer rosak. Sekejap sorry, I'm also having some problems.
Okay, take your time. Yeah. Sorry, it's a different one. Okay, can you see my slide now? Yes, perfectly fine. Yes.
Okay. Alright. So again, Assalamualaikum and good morning. So saya minta izin to speak in dual language, Bahasa Melayu and English. Alright, so today talk will be on application for exemption from ethical review. It's REC 11, Permohonan Pengecualian daripada Semakan Etika. So I just want to share that just to correct the misconception, if there's any, that application for exemption is actually not an ethics application. It's actually exemption from research. So we really need to identify our criteria, whether we want to go for exemption or we want to go for a full ethics review, whether it's minimal risk or more than minimal risk. All right, so and usually this happens as a requirement of journals. So depends on what type of research you're doing, and you need to identify early if that journal requires exemption, and then you apply for exemption before you start to conduct your research, okay? All right. So according to the national statement on ethical conduct in human research, is actually by the Australian government. It defines research that can be exempted from ethics review as negligible risk research that involves the use of existing collections of data or records, and this is important to note, that contain only non-identifiable data about human beings. So I think following from the discussion before, even its secondary data, and if it contains identifiable data, that should go under minimal risk rather than exemptions. Okay. So the standard practice, if we have the following criteria, all right, then it can be considered under exemption. Okay, where the data is completely anonymous with no personal information being collected. So meaning if you're going for secondary data, there will be no collection of names, ID, IC, semua yang identifiable, then you can go for exemption. All right, and the data is not considered to be sensitive or confidential in nature. We need to identify whether we are doing on a vulnerable group population, and then that whether there's increased risk of breach of confidentiality in that particular study. And the issues being researched are not likely to upset or disturb participants. And I think this is where psychological research might not be suitable depending on the type of research, the method too. And vulnerable or dependent groups are not included in your research, okay, then you can go for exemption. And there's no risk of possible disclosures or reporting obligations. This is sometimes very difficult to identify from the beginning of research, but we can look at the risk of research, whether this is a potential. Okay, so full board ethical review application basis. These are all the examples. I think this has been discussed by Prof. Rohana, so I'm not going to go through each one, but if there's questions at the end, I'm happy to discuss. Okay, so when can I apply for exemption, or when can you apply for exemption? When your research, this is just to emphasize from the previous slides, right? The research does not involve human participants, human tissues, and or biological samples, all right? The research does not collect sensitive and identifiable secondary data of individual. Research involves content analysis, like textual analysis, meta-analysis. So it really depends on the journal requirement. So sometimes kita buat research macam ni, we don't actually require an ethics approval. Tapi depends on the journals that you plan to publish. Sometimes they require ethics approval, and you can apply for exemption because it does not include any criteria yang kita dah sebutkan tadi that falls under exemption rather than minimal risk. Where your study involves case study, doctrinal study, policy study that utilizes a qualitative approach that does not involve human participants, sensitive participants, identifiable data of an individual. All right, and also concept paper which synthesizes knowledge from the previous study on a particular topic and presents it in a new context with the aim to fill knowledge gaps. Okay, this does not involve human participants and also does not collect sensitive or identifiable data. For example, market survey, sama kita buat for postgraduate kan, kita ada buat market survey. We don't usually apply for ethics approval, but it depends on what you want to do with the market survey, opinion poll or online vote, consumer acceptability tests, and other relevant ones. Observational studies based on video recording obtained from public domains that do not collect sensitive data and identifiable data of an individual. But this is also very specific to your proposal. It's very difficult to say from the start that all observational studies do not require ethics approval, but this is a general guidance. Filming of documentary, documentation of cultural, traditional practices that have obtained prior approval from the relevant parties, authorities, and does not collect sensitive and identifiable data of any individual. If you look at all these slides, they emphasize on the issue on sensitive populations, sensitive issues, and also the identification of individuals. Activities for quality assurance purposes, kita usually do not require ethics approval, but we can go for exemption, contoh clinical audit, communication audit, compliance audit related to the evaluation of public service programs, public health surveillance, educational evaluation. I just want to share that if you do an audit, if it's completely audit, but then if you have plans to publish, then you really have to look which category this fits in, rather than it's purely audit, or is it actually a research? I mean, that you have to identify. So when we talk about sensitive issues and also population, we're talking about corruption. These are just some examples. There can be more than this. So identifiable entity, vulnerable groups. So we can say vulnerable groups and what they are, but it's really contextual in the form of kita kena tengok your proposal and see how you conduct your research, because sometimes they involve vulnerable groups, but your methods are robust and be able to protect them well, then you can reduce their vulnerability. This is just an example of the forms. Kita ada REC 11 form, tapi for postgraduate tu, I think it's ERC 4, about the same forms, but REC 11 is to REC and the ERC form is to the ERC of the faculty. Okay, the form has 4 parts. Details. Sekejap
Bagian kepada pemilik kenderaan dengan nombor pendaftaran CP3083 CP3083. Sila alihkan kenderaan anda dengan segera. Terima kasih.
Alright, so the form has 4 parts. So the first part is part A, details of researchers, part B, research details, part C, justifications from ethical review, part D, agreement to conduct research, and part E is verification from department. I just want to share that because this form is very simple, does not necessarily mean that you pun letak very simple details. I think the research details need to be complete. It needs to be very clear to the reviewer what sort of research you want to do. Your methods needs to be clear so that we can really say this is an exemption. Maksudnya from your proposal tu, you can transfer the details in the form. Justifications from ethical review. You really need to reason out why this should be under exemption, all right? And why it does not have to go through the minimal risk, more than minimal risk punya process. There's agreement to conduct research, and the last part is the agreement from the department. Actually, this is the faculty and also the postgraduate committee. So just to share, this is the form. So you have details of the form. So the research details ni, sometimes the applicants, they write very simplistic format of their research in this form. And as a reviewer, when we assess this, where the application, is very difficult to gauge what their intention of, is this really exemption or this should go under minimal risk, because it doesn't mean that when you submit this form, REC 11 or ERC 4 form for exemption, that it will go under exemption, because it depends on the reviewer, dia punya decision whether they should go beyond exemption where it goes under minimal risk ataupun it is actually more than minimal risk. So the decision is still at the level of the reviewers instead of the applicants. So you really need to detail out your research in this form so that the reviewers understand. So research risk, I just want to highlight that there can be macam misconception that applicants ataupun researchers, when they apply for ethics review, diorang takut nak letak the research risk, because they think that if they put in or list down the research risk, that this can be it will go beyond what they have applied for. So for example, exemption, dia akan pergi kat minimal risk. Kalau dia letak kat minimal risk, dia akan pergi more than minimal risk. But actually, if you are able to identify research risk and you're able to provide a mitigation process to reduce the risk, I think that's more satisfying, and you can actually reduce your research risk rather than not putting in. Okay, because eventually when it's being brought to the attention of the reviewers or at the committee level, we will be able to identify the research risk. And if you already put in research risk kat sini, then we understand that you understand what you want to do and you're able to reduce the risk based on your mitigation plan. Okay, if you look at part C, there's justification for exemption from ethical review. So you tick where applicable dekat all these boxes. So for example, this research does not involve human participants, human tissues or biological samples. Tapi let's say you want to do research on human participants, the secondary data, you tak perlulah tick yang tu kan. So you can go to the next one. So this research does not collect sensitive and identify secondary data. So you're actually taking research, you are conducting research on human participants, but you're ticking that it does not, you do not collect any sensitive information from the participants, or it does not involve any sensitive issues, and you're not collecting any identifiable secondary data of an individual. So with the collection of data, you won't be able to identify who's in it. All right. The research involves content analysis, textual analysis, meta-analysis. So kat sini, if this is only involving this, so maksudnya dia tak involve human participants, does not collect sensitive issue, and also at the same time, it's actually on content analysis. Alright, so you can tick all. Don't be afraid to be honest. Okay, just tick apa yang you rasa applicable and not applicable. So the second one is the fourth one is case study, doctrinal study and policy, and then the next one is concept paper. Tadi kita dah mention, also market survey, observational studies, documentary filming, activities for quality assurances and others. Okay, again, don't be afraid to list down what you think would be necessary for the information of the reviewers so that they can be satisfied this is exemption. Okay, so contoh exemption is corruption, fraud, specific entity review, vulnerable group. Again, this is very subjective depending on how you write your method. Okay, and the last one is just to list down all, okay, kita all yang terlibat with the research. If you do not have space, you can always include another page to include all the researchers involved in your study, because at the approval at the letter tu kita akan letak semua nama researchers. So if you don't have your names here, your name will not be included in the letter. Alright, I think I've actually come to the end of my Okay, so this is the same one. So this is the ERC 4 tadi. This is for postgraduate and undergraduate. Postgraduate by coursework. Alright, it's something similar. Okay, sama juga. So details of researchers. So kat situ ada masters by coursework atau undergraduate. Okay, I think it's also good if we have a specific information on what's the title of the masters, so it's easy to review, and of course we have all this. Kalau kita tengok space tu again, it looks very small. You can actually write whatever you want there, and ni dalam bentuk words kan. So make sure that you have all the details in, so that reviewers do not have to cut the proposal and then buka here, because whatever that's important in the proposal needs to be transferred here, so it's easier for us to have a look at it. So in this form, you take, okay, so ni pun ada juga orang yang tersilap. So if you read carefully, this research involve, sebab ada orang tukar, this research does not involve. So okay, kita go with this original form. This research involve human participants, human tissues, you can tick yes or no. Even if you tick yes, it doesn't matter because you're going to go to the second and third column kan. Kalau if you tick yes here, human participants, but you're not collecting sensitive and identifiable secondary data, you tick no and it does not involve sensitive data of an individual, organization, and you tick no, it could still be under exemption. So don't be afraid to put in yes kan. Sometimes students and diorang confused. So supervisors are there to guide them. So sama juga this C2 part C2 of the form is actually the ones yang I've already mentioned earlier. So you tick which one most suitable for your research that would justify reasons why your research goes under exemption rather than the ethics review. Okay, again, it's the same one as REC 11 in this ERC 4. All right, that's agreement to conduct research. So you can also put in all the researchers' information here in the form. And I think this is the end of my slides. Thank you. I'm happy to entertain questions if you have any. Again, we also have experts in the room, I would say room, to help answer the questions as well. Thank you very much.
Thank you, Dr. Amy, for a very informative talk. So I open the floor to the audience for any question.
Hello, Assalamualaikum.
Waalaikumsalam.
Yeah, I'm Dr. Nurul. I have a question. It's regarding the sensitive data and also vulnerable. For those who involved in cyberbullying, is it considered under cyber fraud? Thank you.
I think it really depends on the way you structure your research. Apa maksud cyberbully tu and how you want to provide support for the cyberbully. I really can't say it up front that it's but the look at it macam it's a vulnerable it involves vulnerable issues because of the cyberbully, but I really need to see how you frame your research to say that it's exemption.
All right. Okay. Okay. I think. Okay. The situation is like this. It involves cyberbully victims, but it wants to look into what we call it a good solution for the case for the cyberbully effect and for the future avoid of this cyberbully. So there is a contra here for me whether it is for the minimal risk or more than minimal risk because it involves the cyberbully victims, and also the question might trigger all those trauma for them. So how is it for me as a REC to view this case? Thank you.
Right, thank you. So it's clearer now how what it involves. So when you involve participants who have been traumatized for an event, and depending on the types of questions you're asking, there can be triggers and you need to identify ways on how you can support them. So for example, kalau macam ni, for me, I would say it's more than minimal risk because of the risk of triggering their traumatic events. But to reduce the risk, kan, kalau masuk committee, I would like to also know what sort of ways that you have put in your research to give support to those who actually have that triggers during the interviews. Okay, so for example, kalau you identify the traumatic trigger tu, would you then have a counselor or a psychologist with you together at the interview to help them when they have that trigger, or you have ways to refer them for psychological assessment later on to help them with their punya condition.
Okay, thank you, doctor. Helps me a lot.
All right. Thank you. Any more questions? I'm not sure if there's any at the. I'm trying to have a look at the.
Assalamualaikum, doctor.
Chat. Waalaikumsalam.
Doktor nak tanya macam kalau kita conduct the research, collect data guna online tu kan, survey. Lepas tu the data tu kita boleh simpan dalam email kita tu sampai satu masa ke apa ke macam mana ya? Untuk handle the data tu.
Okay, that is something that you need to identify and masuk kat dalam your methods to in terms of storage data. You cannot have that data stored forever because kita tak tahu later after, let's say after 5 years you nak buat apa lagi dengan data. So dalam your REC form tu sepatutnya perlu letak how long you want to store the data. So maybe 3 to 5 years, and then you're going to hapuskan, discard the data because we don't want any misuse of data yang tak terbabit dengan your application earlier on. I hope that answers your question.
Dr. Amy, can I add?
Yeah. Okay, boleh.
There's a balance between this confidentiality and also what the publishers of the journal want, because sometimes you have to keep the data like for 15 years for the editor of the journal to check whether you got it, you made it up or whether it's real. Some people play, just created imaginary data. So that's why we need to keep the data for a while, yeah.
Okay. Would we be able to do from the start, Prof? How long?
Yeah. Maybe, yeah, that's right. Yeah. You should decide and inform the relevant people, that you're going to do that. Particularly the participants, I suppose. There are questions from the chat, yeah?
Okay, itulah I'm trying to have a look at it. I think it starts from 10:30. It's like from Dr. Muhammad Rafiz. I'm not sure to whom you're asking this question, but I'm just going to read it out. Prof, let's say we are publishing a paper with collaborators from other universities. The samples were obtained from University A and the researcher has obtained REC approval from University A. However, the main and corresponding author is from UiTM. I think the best to answer this question would be Prof. Raymond. I would say that because you're the main and corresponding author that you would require our approval, but maybe Prof. Raymond has a different answer. Prof. Raymond?
Yeah, that's why because of publication requirements nowadays from the editor, you have to, from the beginning, I think, engage the ethics committee because the aim of research is to share your output, right? So it's going to end up in publications, whether it comes from other universities or not. It's better to not sure submit, I think, to UiTM's university. I think both IME committees have to know.
Alright, okay. So maksudnya UiTM pun kena dapat approval lah kan, Prof?
I think so, yeah. Makes sense, I think, yeah.
Yeah. Okay. All right, thank you. I hope that answers the question. The next one would be for students undergraduate. If let's say the reviewer comments that the application has minimal risk and does not exempt it, do the students have to fill? I would go for yes, because there's different forms needing for approval. So you cannot use ERC4 to apply for a minimal risk because it's a different pathway altogether. So if let's say the reviewer, but please don't feel deterred with the processes. I think we just want to do it right. So the information in ERC4 can be transferred to ERC1 and 2. Tak ada masalah. Cuma maybe you have to detail out certain information more than the ERC4. All right. And the next one, if data collected from government institution about number of accidents happen in schools, will it be exempted? I think really it depends on how the methods of collecting data. We have to look at method too. I think it's really difficult to say upfront whether it could be exempted. It depends on the data. Whether it's identifiable, whether it's sensitive, because looking at the accidents and what are they going to do with the data that we have. Yang itulah we want to know more information on that.
I think there's an
Alright,
example in the workshop nanti. There's an example in the workshop.
Okay, very good. So if you have questions, nanti you can also ask your facilitator. I'm sure that we are all happy to help. Any more questions? Okay, kalau tak ada, I think I have 1 minute left and I'm going to pass over to Hisham. Thank you very much.
Okay, thank you very much, Dr. Ami, for an informative talk and for an engaging question and answer session as well. So we've reached the first half of the morning session, I guess. So we'll be taking a 15-minute break for all of us to freshen up a bit, and then we'll continue again at 11. So see you again at 11. Yeah, thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Welcome back to the workshop and talk. Thank you for rejoining us. Next in line is my session whereby I will explain to you how to use the RED system as a reviewer. All right, and I understand there's also joining us today participant via YouTube. Maybe those who have never used the REC system or even look into our REC website, which is recuitm.org. So my talk will slightly cover all aspects, but mainly we focus on the review perspective. Okay, so for all participants, you can go to our website recuitm.org. This is where our documents, everything is situated here, can be found here. All right. So the
Relax.
You need expertise. Yeah, you already have to.
Saya tak boleh
You already
ikut.
have it.
when the secretary mute or kick the. Okay, thank you. So for application, just scroll over here, application tab, and you'll see this link, the first link, RED system. So click on that, and you click here to go to the RED system itself, right? But if you scroll down below, you will see 4 manuals given to you, and we'll be looking exclusively on the third manual, which is the reviewer manual. So you can click on that, right? So this is the manual. It is bilingual in both Malay and English. Okay, first is registration and login. I think this is quite straightforward. If you go through here, for the first time, you have never used it before, register new account. If you have used it before, you can log in straight using your Google UiTM account, right? So for new user, you have to select your user type. If either you are staff, student, or guest. Guest means non-UiTM people, and then register accordingly. Right, once you have registered using your staff ID or student ID, you will have access to the RED system, right? For reviewer level, normally the application comes in, right? And then we have once REC Secretariat have screened it and the application deemed as complete, meaning all documents relevant and required is there in place, we will start to assign a reviewer for that application. For each reviewer, each application will be assigned reviewer from a respective expert. So once a reviewer has been assigned, that reviewer will get an email notification as such. Okay, so you will be required to log in to your system, to RED system, right? And then click on the left-hand side. You should have the review panel. Okay, number 1 here. So you click here and you will have the list of all the proposal that you are currently reviewing, right? And then you can also see the status in which will indicate whether the action should be taken by you or the applicant. And you can look at the status, RED status here. It's also in the website. You can look here. So look at the actionee. So at the review level here on the orange rows. So if the status is review process, so it's the review's action to do. And if it's a revision, it's a review's action. So only you have to be concerned with only two status, which are review process and revision.
With minor corrections. So the student has passed the paper was for the master's degree and for the minimal correction to the thesis and their thesis.
Okay. And then sorry. So based on these two statuses, you have to take an action, right? Once you click on the action, click review, and then you will get into the application. So just for your information, as an applicant, the sort of like layout is slightly different. You have part A, B, C until E and F. You have 6 parts. But as a reviewer, you see the application in 3 parts: part A, part B, and part C. Okay, so you scroll down in part A, and you can be able to see the REC 2, 3, and 4 forms here. And you can also see anything else uploaded by the applicant. Mainly flowchart is a must. Everyone has to upload their flowchart of methodology, as well as questionnaire or any survey question, anything else required in their study. So if doing interview, they should have the sample question uploaded already. Okay, and you can view it there. Right, so you can click there to view the REC 4, 2, 3, and 4. And then you can write your review. Let me check. You can write your comment in part C. So in part C, you can put your comment in the comment section here, right? And then you can select the status if whether it's require correction or not. And at the end, if it's verified, you can verify it here. Okay. So for the status, if it's a minor amendment, meaning it requires correction from the participant, and you can also select whether the subject is children, vulnerable people, athletes, trained person, or healthy or others here, right? Okay, your comment regarding the study can be written here in part C. And once you are satisfied with your review, you can submit it for the next action to be taken. So if it's a minor correction or major correction, the applicant will have to address those corrections first and return it back to you. And the application will change status into revision, where you should take action. And then if you are satisfied, you can approve the application. Okay, so make sure you have submit button appearing. And then you can check again the application status. So just before, if initially you have review process, right? Review process. And then if you have sent the correction request, the status should change to minor amendment. So if you see the status doesn't change, it means that somehow your submission failed to be processed by the system, and you may be required to re-enter your evaluation. So sometimes if the system is a bit heavy or a bit problematic, it's sometimes it's a good idea to write your review somewhere else as well. So it can be quite a frustrating experience. All right. So in the end, if you are satisfied by all the correction made, you can select verified by reviewer here and denote the risk category, whether it's minimal risk or more than minimal risk. So that's why we explain to you that for exemption, as mentioned by presenters before, application for exemption is not currently processed within the RED system, and it is still processed manually via the RAC 11 form, if I'm not mistaken. So be aware of that. So that's why it's important for you to be able to distinguish between whether it's a minimal risk or exemption, because it will have impact on your application process. So if you have if your study is exemption, qualify for exemption, if you apply here, it can be a bit problematic because you have to refill the application form again. Okay. So for each change of status, you will get notified as well, especially when you need to take action as a reviewer. Okay, this is for revision again, similar process. If you get notified to review a revision as mentioned here, as shown here, click action and click review. And actually for any correction made by the applicant, you can view that in part B. So it has like track changes features, whereby if you require them to change something, you can see easily the red strike out sentences are those being omitted from the application, and the green highlighted ones are the new addition. So you can easily see and assess the correction made by the applicant. So okay, that's all. It's quite short because the reviewer's job is just nearly at the end of the whole process, right? If you have problem with reviewing the application or even applying for RED, my suggestion is here. You can either try, let's say my Google Chrome is tied to my account here. What you can do is either log in via guest mode, because when you do guest mode, is similar to like clearing all your cache and browsing data. You can also delete all your browsing data, but sometimes people don't prefer to do this because they may have multiple tabs. They are still trying to do things, so it's not ideal. So my suggestion is either you use guest mode here, right? You click here and you use guest mode, meaning you're starting on a clean slate, and then go to REC and go to RED, and in this method you have to when you log in, you have to key in again your credentials, your email and whatnot. So no worries. Or either way, you can use incognito mode. Wait, I can't remember where's my incognito mode here. So wait, maybe yeah, you can, if you know, you can, yeah, new incognito window here. This is another way whereby it's a clean slate, and this way there's no history. Your browsing history will be not recorded. So this may alleviate or solve some issue with the RED system. So if worst come to worst, nothing happens, you can do aduan ICT. Aduan ICT UiTM. You can Google Aduan ICT UiTM, and then you get this unit system aduan. Just key in your credential first. Okay, then the report information will pop out. For the branch and location details, it doesn't matter. You just put any relevant details that is available. Don't spend too much time on it because you are complaining about a system. So for category, what you need to do is just scroll down and you look for system TNCPI. System TNCPI, TNCPNI, sorry. And then for subcategory, you scroll down as well, you have Research Ethics Depository. And please write the details regarding your problem. And if possible, and this is quite important, you can print screen the error that you want to show so that the technical team can really understand what is your problem. So this is the main purpose of the report, to make sure that the technical team know what is your problem so that they can solve your issues. So technical team is mainly people from ICT. We are not part of the technical team, we are the secretariat. But if any case it's too complicated for you to explain here, you can contact one of the secretariat. We can also help you forward this inquiry or troubleshooting to the technical team. All right, so I think my presentation is the shortest one. It's just a 15-minute presentation. So I open a question to the audience. If you have any question to me.
Assalamualaikum, Cik Syam.
Waalaikumsalam. Yes.
Saya nak tanya macam kalau dalam sistem RED ni, kalau untuk peringkat fakulti, lepas kita panggil student untuk present, then kita ada komen lah daripada panel kan. So kita boleh letak dalam dekat correction juga ke?
Kalau peringkat fakulti, yes, memang boleh.
Boleh
Boleh. Boleh guna platform yang ada RED sediakan untuk bagi komen terus pun bagus, sebab yang saya faham di peringkat fakulti, ini berkenaan Jawatankuasa Penyelidikan kan ke ERC?
Jawatankuasa Penyelidikan peringkat fakulti lah yang sebelum kita
Sebelum
present
penilaian kan? Sebelum penilaian, okey, betul.
Kita ada present, lepas present panel bagi komen, then komen tu saya letak dalam yang correction tu.
Betul.
Lepas diorang buat perbetulan, baru saya verified dan pergi ke EP dah kot.
So Dr. Hasanah, kira apa yang berlaku di peringkat di PTJ Dr. Hasanah ni macam PTJ menggunakan sistem RED in sync lah, bersama-sama dengan proses DRP ataupun penilaian di peringkat Jawatankuasa Penyelidikan. This is good. Some fakulti, setengah fakulti dan cawangan, dia asingkan. So permohonan untuk endorsement atau approval Jawatankuasa Penyelidikan tu dia buat DRP asing dulu. Lepas dah lulus, baru dia minta student atau pemohon tu mohon dalam RED. Kiranya permohonan dia tu telah dinilai di luar sistem dululah. Dan bila dia forward untuk endorsement JPN JPF just approve saja. Macam tu pun boleh. Nak buat sekali pun boleh. Kita cadangkan buat terus macam doktor buatlah. Lagi bagus, sebab kadang-kadang kita nampak certain application yang mana bila buat di luar sistem, sekarang ni secara manual, bila dah lulus nanti, student tu kadang bila dia apply dalam RED system tu, dia copy paste benda yang salah. So kita dapat juga case yang mana dia salah. So saya rasa saya prefer penilaian tu berlaku terus di RED system, supaya tak buat kerja macam 2 kali lah. So tahniahlah Dr. Hasanah sebab melakukan praktis yang terbaik sebenarnya.
Okay, terima kasih. Saya takut salah saja.
Betul-betul. Saya pun nak ada masa ni saya rasa saya nak tunjuk sedikit pasal flow permohonan. Saya tak pasti jika pernah buat ada ditunjuk ke tak tadi. So in short, what I can share with you is something like this. So untuk permohonan undergraduate dan master by coursework. Kita menggunakan ERC form secara manual kan. So dekat sinilah yang Dr. Hasanah cakap tadi, peringkat sini. Tapi untuk dua kategori pemohon ini, kelulusan, sorry dekat sini, endorsement ni, kita perlukan, kita ringankan sikit dia punya requirement. Kita bagi coordinator atau head of program pun boleh meluluskan ataupun bagi endorsement. Kalau yang mixed mode, student research, master of PhD, UiTM staff and bukan warga UiTM, menggunakan RED system kecuali exemption, tapi yang masuk RED system ni mesti endorsement by JPN JPF. So dalam sistem RED kita memang kita dah assign siapa yang dilantik di dalam JPN JPF PTJ masing-masing akan diberi kuasa, diberi akses untuk bagi kelulusan yang macam Dr. Hasanah cakap tadi lah. So boleh buat review dalam sistem terus dan bagi approvekan peringkat ini dalam sistem terus. Dan bila approve tu, kita kena, jawatankuasa kena upload satu surat kelulusan lah untuk sebagai bukti. So ini yang tadi Dr. Hasanah tanya. So untuk penerangan, peringkat REC, peringkat sekretariat kami di Shah Alam, kita hanya proses permohonan daripada 4 kategori ini dan mana-mana permohonan daripada 2 kategori ini yang masuk risiko dia more than minimum risk. Okay. So ada juga yang bertanya tadi, kalau more than minimum risk dekat peringkat atas ni, dua ni macam mana? Okay, kalau dia tahu memang dia minimum risk since the beginning, kita advise untuk guna RED system terus. Kalau memang buat tajuk yang memang kita tahu more than minimum risk, guna sistem RED terus. Kalau tak, sepatutnya di peringkat yang ungu ni, di peringkat coordinator, kalau dia tahu, sepatutnya dia dah boleh advise ini sebenarnya kena apply RED lagi bagus, lagi cepat. Sebab katakan buat study pasal psychiatry ke, tanya soalan-soalan yang sensitif, so most definitely akan kena masuk full board presentation. So di peringkat ini boleh advise, dan semestinya di peringkat ERC ni pun mereka kena tahu kalau dia review, dia hanya boleh review dan bagi decision, bagi approval untuk exemption ataupun minimal risk sahaja. More than minimal risk kena pass over to REC. Dan kebiasaannya kalau dah isi borang manual, borang ERC, kalau dah peringkat review pas kat kita akan proses lah. Kita tak minta lah untuk isi ke RED system sebab kita we try our best to facilitate applicant, and kita tahu proses permohonan etika ni boleh jadi satu proses yang sangat panjang dan memenatkan. So kita try lah untuk proceed terus. Tapi ideally kita mohon melalui RED system terus. Okey, ada persoalan berkenaan RED sistem yang lain? Kita ada lagi 25 minit.
Okay, Assalamualaikum. Saya nak bertanya, untuk subjek contohnya research method kan, untuk postgrad level. Okay, kalau kata pentaksiran melibatkan contoh report of the pilot testing, means that students need to collect data from the pilot test. So is there any possibility that we just apply for ERC forms, or how is it? Do we really need that? Macam mana ya? Terima kasih.
Okay, sama-sama. Thank you for the question. I'll answer first. I think later I'll invite other members who are more experienced than me to answer. I think for pilot studies, you are not really required to apply for ethics approval. You are required to observe ethical practice all the time. But for approval, I don't think you need for pilot study because one, it's a small scale study. And second, you don't really publish based on your pilot data. So that is my answer. If anybody else who could add on to that answer, I would invite.
Hisham.
Yes, Prof. Raymond, yes.
Yeah, I don't think that's right actually, because ethics approval is required as long as it follows all the criteria that's been mentioned before. It involves humans, vulnerable subjects, however small the study is.
Okay.
As you said, it's not going must follow ethical principles. So who's going to check that? It's going to be us, the REC. I know it's more work for us, but it's not the size of the research. I think it's who we are researching on. And better, we've had so many pilot studies, Cik Syam submitted to us. And then sometimes we say better do pilot study first, sometimes, but still will come to us. because of the principles of ethics rather than the size of the research. Yeah, I don't know if that answers the question of the participant today.
Okay, thank you, Prof.
Okay.
Raymond. Yeah, I think I agree. It's because I was thinking pilot study about like lab based does not involve human, but yes, I think pilot study or not, as long as it involve all those principle involving human, as Prof. Raymond said, yes, you have to apply.
Alright, okay, thank you for the answer. But okay, I ada extended question lah. Okay, regarding the same case yang macam I cakap tadi, kalau
Hmm.
kata for that class kan, for example, I ajar tahun 2024 for 2 semester for example. So kalau I apply for the ERC form, so boleh tak macam kiranya sekali I apply for 2 semesters. Is it possible but with the different cohorts of student? The
Yeah.
question, dia punya research, research methodology, problem statement is same lah sebab lecturer yang keluarkan. The thing is, the student, they just do the pilot testing only. Okay, thank you.
For that, I think it is possible as long as you declare your research timeline cover both cohort. It should be okay. As long as you include in your application, should be okay.
Okay, thank you for the answer.
Alright, you're
I
welcome.
think Hisham, if this is the same study, why doesn't she apply from the beginning? List all the researchers, because the qualification or the PI is the same is one thing, but
Yep.
student is going to be the PI, I think, the principal investigator for that project, right? So the REC has a task to also look at the suitability of the researcher, So the name, the person who's named in there is also important, not just the study. If you look back at GCP and general the good clinical practice, the suitability of researcher, suitability of the place of research, and who else invest in the investigation team has to be evaluated. So I think there's no shortcut there. I'm afraid that the best thing is to apply early, because it takes a while. But I think this is for students, they have a faster pathway, kan, Hisham? I mean, they don't have to go through, unless it's a clinical trial.
Yeah.
Then it's going to be more time consuming. But I think for doktor yang tanya tadi, we kena tak boleh blanket approval, because the researcher punya suitability tu, I know it's from the same faculty, same department or same group research team, but we have to look at the name of that person, I mean, look at the individual. I don't know who else in the team can, maybe Dr. Khasno or the others can also give their opinion.
I will leave it to I will get the expert from with various past experience in jawatan kuasa, maybe can give an insight lah.
I think I want to add. I think I agree with Prof. Raymond, but I missed the part you said applying via ERC. So when you talk about ERC form, it's student. So when it's student, different cohort, if it's different student as the researcher, yes, as Prof. Raymond said, he or she has to apply so that they know what they're doing.
Yeah.
Reapply, yeah.
That's correct, yeah.
But another thing to take into consideration is the timeline of how long the approval of the ethic is valid for, in case the planning of the future research too actually is being done after the approval date lah. So that's another consideration if the gap is too long. So it may not cover to that long, to that length, I guess.
Yeah.
Yeah.
Okay, thank you for the question. Next question from the audience.
Selamat pagi, Tuan Hisham.
Okay, selamat pagi.
Ingin tanya sini. Ya. Student, do they need to attach their questionnaire in the red when they apply for REC. Sorry if this question is being asked earlier. I was involved in the
Yeah, it's okay. It's okay.
presentation just now. Yeah.
Yeah. So for your information, all relevant document used related and used in the research, such as questionnaire, survey, must be attached and uploaded in the RED system. These sets of questions must be sort of like ready to be presented to the reviewing panel so that we can see what is actually being asked. So yes, that's the short answer is yes.
Okay. Second question is I've been asking this for a long time, but I haven't really have a satisfactory answer. In the form BRC2,
Yeah.
number 13, it says peserta itu bukan atlet ataupun bukan tidak sakit lah. So
Yeah.
for low risk, I mean for non-risk, does the applicant need to answer yes or no?
Sorry for the REC. Let us show the
question number 13, 1-3.
So for
ERC
ERC form 2, yeah?
Form 2 or 3? 2, I think. Yeah. A series of questions.
Yeah. Is it REC 3? Wait.
Yeah, when they have a serious question, ada soalan-soalan macam soalan-soalan tu ditanya tu.
So number what you were saying? Number
13.
13. ERC 2. Wait, not ERC 2. ERC 3, is it?
Yeah, 3. I think 3. Yes.
3, yeah. Okay, wait, yeah. Three. Question number 13.
Yeah.
Can you read the question? Sorry, I can't seem to get the right documents here.
Hold on. Yeah, let me open it in mind. To get the exact, yeah. REC, where is my REC?
Saya rasa ERC 1.
ERC 1. Okay.
It's like the checklist question tu.
Okay, thank you. Wait, let me check. I have not seen ERC 1.
Check.
Oh, okay. Checklist, yeah. Okay. So number 13, okay, the other participant, wait, I can't, let me share the WPS office. Okay, so this is the question given in ERC1. Yeah. So can you see my my presentation? So under part E, question number 13, we have the participant non-athletes or patient with chronic illness. So your question specifically was what, Dr. Haijon?
Is the for low risk, or on less than minimum risk, the answer is supposed to be yes or no?
So are the participants
because if they say yes, they need to justify, right? So
if yes, then it can be more than mean risk. It's just a indicator for us. It's not necessarily definitely more than minimal risk. But for example, it depends on the type of things, type of research that you're doing as well, as previous speaker have said. So if the research is not sensitive and asking general questions, maybe it does not fall into MMR. But if it involve like strenuous exercise, some intervention, drug intervention, so definitely it's gonna be more than minimal risk. So this is just one of the many questions asked for the applicant to declare whether the participant is such or such.
So if they say no, that means they are not athlete, they are not high risk, right? So,
Yes.
but I think it's confusing because a lot of the applicant they answer yes because that answering are they not athlete? So they said yes, they are not athlete,
Okay.
and they don't give any explanation. But normally I just ignore it because I understand. But I
Okay.
just wondering if we can reword it. I mean, when the
Yeah.
time,
So
yeah.
I understand the issue. So the wording can be quite confusing here. So maybe we can reword it so it's easier. So thank you for your comment, Dr. Haijan. Yeah.
All right. Thank
I think
you.
can I just add
Okay.
on to this?
Yes,
I
Prof.
can
Rana.
see how confusing it is. And yeah, we'll take note of that. But I think why we put it in as non-athlete masa tu was because from sports science, they used to have this research of rigorous exercise lah. So to them, it was quite standard. So our concern at the time was that if these exercises were being done in normal patients who do not do regular exercises, then that becomes an issue lah, a concern, because they may not be fit enough to do these exercises. So they used to describe from sport science, they used to describe these exercises that they say, oh, we do it all the time, and this, and then so we're saying that it's not actually standard that we do lah. So that's why. But I see why it's confusing. And I think we'll take that into account. Thank you so much for pointing that out.
Yeah. Thank you, Prof. Rana. And I think to add on that, I think this form for us to inspect it, we'll see a lot of question. Normally people will answer no. So that's why the wording is like that, so that the safe answer is no. I mean, if you look at the other question, most likely if the research is low risk, it would be no. So maybe they are trying to word the question so that it's line with answer no. But I get your concern and I agree. So we'll look into it. Thank you very much. Any further
Morning.
question? Yes.
Yeah.
Morning.
Morning. I'm Wong from Penang. I would like to ask regarding the approval of the ethics approval. How long the ethics approval be granted? Is it according to the duration of study or is it on annual basis? That's question number one. If let's say the investigators would like to do amendment with regards to the study protocol, so how should we go about it? And is there my last question, so do we need to, as an investigator, we have submitted the ethics and it is approved, and then we have done the research, do we need to submit any end of report just to close the ethics? So 3 questions. Thank you.
Okay, thank you very much, Doctor, for your question. Let me share with you the okay, the tab again. All right, for the first question, expiry. For expiry, we will give approval according to the sort of like timeline applied by the applicant. Normally, the review will also look into that, and as long as it is reasonable and justifiable, we will give the approval according to the request. All right. For the second question regarding amendment, so if you have applied in RED system and you have gotten your approval, so for any amendment you need to do, unfortunately at the moment you have to do it outside of the system. Go to rec.uitm.org again, go to application and go to the third line. This is other REC forms. So you click here, right? You will be able to see there's like three forms that we use separately for each different purposes. First one is in case you want to add or remove project members. So you fill up REC 7, download and fill up REC 7, and then you submit to our email recsecretariat.uitm@uitm.edu.my. Okay, and then we also have REC 13, application for extension of research. So for example, you require additional time. Maybe last time COVID happened and then everyone extend their research. So all of them submitted REC 13 for extension. And for other amendment, you have to download REC 10. This is cover letter for amendment, especially for protocol or change of addition of location, anything other than research membership and extension of expiry, you put in here. So you will see when you download this, you will see a table whereby we will ask you to put like a before and after. So what is the original statement in or procedure, and what is what are the changes made for the reviewer, for your original review to see easily. So without this, it will be hard for them to see what is being changed in the proposal. So you need to use these three forms, right? And lastly, for end of report, what you can do is you can download REC 8 and submit your project completion report. Again, this is not within the RAD system. And if you have done your project, complete your data collection, you can submit your report based on REC 8. Okay, that's it. Thank you for this question. It's very helpful. Yeah. Okay, I have. Yes.
Good morning. I'm Lee
Morning.
from UiTM Sarawak. I just
Yes.
want to know one question. If I apply, normally when we do research on social science, if we have this pilot study, right? So if we apply do we need to apply for REC approval before
Okay,
the actual questionnaire is being given to the participants?
Okay, thank you for the question. As mentioned before, as long as the study involve human participation, whether as mentioned by Dr. Hasno before and other presenter, as long as whether it's a pilot or full study, you still are required to apply for ethics approval. So when it involves human, you have to apply for ethics approval. So the answer is yes.
Okay. If yes, let's say after the pilot study, then we have some amendment in the questionnaire, right? Then we need to submit two sets of questionnaire, one on the pilot study, another one on the actual interview.
For pilot study, I think you can make it as part of the application. Maybe you apply the first part is pilot study, the second part is the actual study in one application. You can do that, but if you are doing that, you have to submit beforehand whatever questionnaire you are planning to use. But once you've done the pilot study, maybe if you have anything update, let's say even procedure or even some of the questionnaire that you are actually giving on the second part of the study, which is the actual part, you can update update us using the forms that I've told just now, REC 10. Perhaps other member have other opinion on that regarding the flow. Maybe if I was saying about if you apply everything under one application. If you apply separately, then it's a different story. You can apply for your pilot study first. Once you've done that and once you have updated everything, when you apply for the actual study, a different ethics application, and then there's no problem because you have all the updated document in your hand for the application.
So we need to apply 2 times, Mr. Isham?
It's up to you. Maybe easier 2 times so that the reviewer can understand things one by one. Yeah.
Okay.
Can I perhaps add to that, Hisham? I would say if you are pretty clear in your mind what you want to do, usually, as Prof. Raymond was was saying earlier, pilot studies is probably determined mainly by the sample size. Objectives remain the same. So if you are very clear on what you want to do, so I would usually encourage researchers to include everything. So we as a reviewer can see the flow. So you have a pilot study of say 20 people, and then you aspire to do this intervention study subsequently, or whatever, like questionnaire, whatever. So it's easier to see that way, where you have to clearly outline lah kenapa, what, and justify why you have a smaller sample size in the beginning, and then you have your inclusion criteria, blah blah blah. So it becomes a bit more complicated, but it becomes comprehensive, and then you don't have to apply that another time, because if you want to apply it separately, then you kind of like have to get the pilot study going, and then from then on, later you have to, when you apply for the actual one, you have to kind of include the result from the pilot study pula to justify why you're doing the bigger study, things like that lah. So, but it really depends on the scale, the magnitude of your study, the objectives and all that.
Okay. So, Prof. Rana, let's say we submit through RAC 2, right, to apply for this. Then once the pilot study is over, we also need to apply for RAC 10, right, for the actual one, the amendment one.
It depends which one that you're using. So if it's your intervention study, you're still doing RAC 2. If it's a questionnaire based, there's a few studies.
Yeah, it's a few study.
A few forms. So you have one for the minimal risk, one for more than minimal risk.
Okay. So I will need to submit the pilot study and also this through one form now. Yeah. Okay. Thank you very much. Yeah, I understand that. Thank you very much, Prof. Rana and Mr. Shah.
Okay. Thank you, Dr. Lee. I think I've reached my time, 11:45. So thank you very much for your participation. Whatever question you have left, you can write down in the chat box and we will answer it as time permits. And now for the final session, final talk, I would like to invite Associate Professor Noziatun to give a speech.
Alright, thank you.
Yeah.
Thank you, Syam. Yeah, Assalamualaikum. Alright, I will share my slides, yeah.
Okay.
Okay, can you all see the slide?
Yep.
Alright, good.
Okay.
Okay, alright. So just stay on, yeah. This is the last slot. Okay, so I'll just make it fast and sweet so that kita boleh lunch lah afterwards, yeah. Alright, so basically, just to wrap up about what has been presented by the earlier presenters, yeah. So I'm just going to skip few of these slides because it has already been highlighted. My focus will be on RAC 2, 3, 4, and 12, and also FBRC 1, 2, and 3. All right, so who manages research ethics? It has been highlighted by Dr. Hasno. Then, okay, so when we talk about why do we need to do research, basically is to protect ourselves, has been highlighted by Prof. Rohana. All right, so who needs to apply? Okay, so basically under this, we have two, yeah, it's either RED or ERC. All right, so basically who needs to apply? UiTM master students by dissertation, applied research, or even undergraduate final year project students, master by research, MBR, PhD, or even staff. So projects requiring ethics approval, again, just to recap, human participants, use of human products, studies that may potentially impact human participants. All right, does your research intended to include any of the following methodologies? If it is yes, then we need to apply. So that will be interviews, questionnaires or surveys, analysis of any kind of social media, ethnography or observation, or even any other methodology that involves live human participants or their data. All right, so again, does your research involve any of the groups, patients, children under the age of 17, we call it as minors, vulnerable adults, or people engaged in any criminal or illegal activities? Okay, so if yes, then again, we have to apply for ethical approval. Traveling into high-risk destination, for example, foreign countries, or let's say Palestine, maybe anywhere you might put yourself at personal risk, or even any other location that you think might be of high risk. Okay, so does your research fall under any of the above mentioned categories? So again, if it is yes, then you need to apply for the ethical approval. So basically, we have already highlighted on the application process, procedures, what are documentations and all that. So you can just refer to the forms, REC or even ERC, and also to discuss your project methods or any ethical issues with the supervisors or even the teaching lecturers. Yeah. All right, so this will be the SOP for postgraduate students, MBR, and PhD, and also staff, where we will make use of the REC documentations, which will be approved at UiTM level. And of course, Hisham has already highlighted about the RAD system. So this is the manual, meaning that the application, some faculties, I believe that even in my faculty of accountancy, we fill in the documentations manually, then we forward it to the committee at faculty level for the first screening. Then once it is done, approved, then only we will submit through the system. So there are also where the students will just, or the staff even, put all the information in the system, they print it out, and they will email to us for review. So there are many ways of doing it. All right, so documents related to the application for research ethics for MBR and PhD or even staff will be REC 2, 3, 4, and also 5 and 12. 11 has already been explained by Dr. Aini. Okay, REC 2. Okay, so this is from the system view. Okay, but if it is done manually, then these are the particulars that you need to fill in. There are 5 sections altogether. Research details, part A and part B, funding, if any, agreement to conduct the research project, or and also the verification. And all participants or applicants are required to fill in all the sections. None of it should be left empty or unattended. All right, so basically we have here part A, details of researcher. So you have to fill in all the necessary particulars, information, and bear in mind that the one in the dotted red lines here is for clinical studies. For those who are other than that, so you just have to leave it non-applicable. Okay, so we are not going to fill in any of the information here, but the rest of the information need to be filled in accordingly. All right, so next, does the research require any external research ethical approval? Again, it depends on your on the faculty itself, but for me, we do not have any external committee, but I believe that from the Faculty of Medicine, they will have external committee that will need to examine or maybe need to get their approval. Yeah, so if it is yes, if the study involves premises governed by external bodies, studies conducted at the Ministry of Health, hospitals, yeah, which requires the Medical Research Ethics Committee. But other than that, from my experience at my faculty, we do not have any of the external committee. All right, so the next part will be research funding, whether it is a yes or a no. Again, all information need to be answered. None of it should be left unattended. All right, so the research details, basically you can choose more than one. Some might have a few methods, interviews and also focus groups. Some might have case study and etc. So it's entirely up to you, your methodology. So you can take more than one if applicable. Now, the background, basically here, you need to explain, a brief explanation will do, yeah? But what we notice, some of the applicants, they will just cut and paste few pages from the proposal and they will just paste it here. So I would advise just a brief explanation about the background of the study, that's it, so that the reviewer will have some rough ideas of what is the research is all about. So in this particular background of study, you can briefly describe about the study, the independent variable, dependent variables, the population that you have. Okay, that's about it, yeah. And also the problem statement. Okay, please include the latest problem or issues that you need to highlight in reference to the background of studies, and also whatever references that you use that you have cited need to be listed. So we have also come across that some applicants did cut and paste the whole lot of the references from the proposal. So it is only should be only the one that you cited. Yeah, other than that, it should be removed. So we have to make sure that when the applicants fill in those information, is only the one that is relevant. All right, the objectives, it depends on your study. It should be numbered. Use measurable verbs to compare, to determine, to investigate, to examine, yeah, to be aligned with statistical analysis, and what are the expected benefits. So you have to briefly explain or describe the social benefits to the study subjects, to the researchers, to the stakeholders, how basically this particular research can benefit these people, yeah. All right, the date of research commencement and end, for example, here for undergraduate studies, at least 2 semesters or until the study is completed. For student by dissertation, will be the period starts and the period ends. And the expected date of initial data collection, basically it has to be roughly around 2 months after REC approval. So date should be after REC approval. So plus minus, if let's say in a month of March, early March, when you submit your application, so the expected date will be somewhere in May. All right. Next will be the location. So location should be specific. For example, here, where is the location of the research? The Faculty of Sports Science, for example, Shah Alam, Dataran Kemerdekaan, or wherever it is. Yeah. So research design and methodology, to specify the study design. You have to describe the methodology, the data collection procedures, the tools. Are you using questionnaires based? Then the number of questions, for example, we have demographic, or maybe we have other different sections, so it has to be described. And the inclusion exclusion criteria, okay, this part usually is a bit critical because some of the applicants, they are not aware or they are unsure, okay, what are the inclusion criteria and exclusion criteria. Here basically inclusion criteria will be what are the criteria that you want to add on, yeah, as part of the samples, and the exclusion criteria will not be part of the sample. So whichever inclusion that you feel that, for example, your research is on external auditors, and of course, the inclusion will be external auditors, exclusion will be internal auditors, as simple as that. All right, then the sample size will be based on a calculation. It depends on whichever table that you use, G-Power, for example, or maybe Krejcir Margin, it depends. All right, but you have to make sure that how do you calculate and to come up with the sample size. All right, so research flow chart, okay, mostly the applicants confuse between research flow chart and also Gantt chart. There are also some yang kita review, we found out that the applicants basically they prepare Gantt chart instead of flow chart. So it has to be flow chart, meaning that from the start of the research until the end. It's not the Gantt chart in terms of how many months it is supposed to be done and all that. Yeah, so please make sure that it is a flow chart or not a Gantt chart. So statistical analysis aligns with the objective, of course. So basically, for the social science or maybe any other area of field of research, we would like to use SPSS, maybe PLSM and all that. So you have to basically briefly explain about the tools that you want to use. For example, t-test, ANOVA, for what reason, and of course it has to be aligned with the research objectives that you have mentioned earlier on. All right, so here will be the funding part, okay, where if let's say your research is funded, so you have to fill in all the information here. Otherwise, you just need to write as non-applicable, but please do not leave it empty or unattended. All right, then the last part will be the agreement to conduct the research. So here, this section need to be completed by the staff, signed by the staff or the postgraduate students only, right? So all this information need to be filled in. All right, if you have supervisors for PhD or MBR students or even dissertation students, you need to include the number of supervisors. So what I have come across, basically, the students only fill in the main supervisor. So if you have more than one, so they have to put in 2 or even 3 supervisors. Yeah, but sometimes we have come across because the box here is only one box, so they do not cut and paste, so that they only fill in the main supervisor. So sometimes I find it difficult where we do not know who are the co-supervisors at the same time. So for us to ensure that we have all the supervisors in place. The penyelidikan sama or the co-researcher also. Then at the end here, all right, so we will propose whether it is minimal risk or more from minimal risk. Yeah, so it has to be signed by the pengerusi or the chairman. Yeah, so this is basically the REC 2 form. If it is to be done manually, meaning that we download the documents, then we fill in the documents manually rather than through the system. So the information is more or less the same. All right, so the next part will be REC 3. Okay, this is the view from the system. All right, so REC 3 basically looking into research risk classification form. All right, and here we have 4 sections: subject profile, privacy, risk of harm, and other ethical issues. Again, all information need to be answered, not to be left unattended. Okay, so basically, since I'm from social science, so most of the information here is not applicable to me. Yeah, so if it is yes, then you have to fill in those information to look if vulnerable participants are to be used. So if yes, then you have to describe. And if it is more than minimal risk, it has to be presented at full board under REC UiTM. All right, so here to ensure element of volunteerism, yeah, so tak ada paksaan, no cohesion here. So subjects unable, so incapable of giving consent, for example. So all this need to be described, whether it is yes or a no, or it is not applicable to your study. Yeah. So if the answer is yes to any of the questions, you have to explain how the risk can be mitigated. That will be from question 6 until question 8. Okay, again, risk of harm. If the answer is yes to any of the questions, explain how the risk can be mitigated from question 9 until question 23. Okay, so that is for REC 3. Then we have REC 4, consent. Okay, this is the view from the system. So basically, the manual form, okay, where we have, it has to be in a bilingual form. English and also Bahasa, except for international students that we understand that they are unable to have Bahasa to translate into Bahasa. So usually if it is local students, we expect that the form REC 4 should be in bilingual. So these are the information that need to be filled in. And of course, it has to be in a non-expert language. So we do not expect any jargon or even too technical information, because this information is a consent form that it has to be given to the participants who voluntarily to participate in your study. So information written should be simple and easy to read. Yeah, so try to detect presence of jargons. Procedures written should be informed that participants is expected to do if they decide to participate in the study. So then again, research risk. So you have to identify whether it is there any risk involved in this particular research. And of course, during the confidentiality, you have to ensure that your number and also your name should be presented here. If any of the information is missing, we will try to ask the applicants to redo or to state your phone number in case of anything. The respondents can contact or liaise with you directly. All right, so that will be for REC forms, yeah. Okay, so now we are looking at the FBERC or the ERC, where these applications will be approved at the faculty level saja. So meaning to say that these are the applicants for undergraduate students for final year projects and even master by dissertation. Okay, so all applications need to be submitted at the faculty level and approved at the faculty level only. So the reviewer will receive the forms via email. Yeah. So basically, the applicants will download those documents from the website. They will fill in all the information because it is not under RED, and then it will be submitted to the faculty for review. Then it will be approved at the faculty level. So I will only covering 1, 2, and 3 because REC FBRC 4 has been covered by Dr. Aimi. All right, for the application form is similar, right? So if you look here, that these are the information that that the applicants need to fill in. So we have to ensure that the title is there, the name of a student, supervisor, if any, the faculty, and all that, right? Then participants information sheet. Sorry. Okay, so again, similar to REC4, where it has to be in a bilingual form, and all this information need to be put in, then none of it to be left unattended, and all need to be in a very simple words, yeah. So maximum of 300 words, for example, the introduction of research, purpose 150. So it should not be more than that, and so they have to simplify it in a way that it is easy to understand. Then again, you have to provide your name and direct phone number is similar to REC4, yeah. And for this particular part of the forms, usually we just leave it empty because it needs to be filled in by the participants, but not the applicants, yeah. So when you forward your questionnaire, for example, for the participants to answer, so they need to fill in these particulars, yeah. So therefore, we have to leave it empty. All right, so FBRC 3, this will be SN form. So SN form is similar to REC2, right? So you will see here, it is form in the form of bilingual, similar questions, yeah, but it has, it need to be presented. It has to be filled in. None of it should be left unattended again. And of course, you need to provide the name and your phone number, okay, in this particular section. And again, you have to leave this particular part blank because it will be filled in by the respondents only, but not the applicant. Yeah. All right. So basically, which forms that you need to fill in. Okay, so now throughout the presentation from the first presenter until to myself, yeah. So I hope that we have the holistic view of what are the forms that you need to fill in. They are from the RED systems or it is being done manually, regardless. So you will see here that the RED system, that will be from the system itself. If let's say applicants would like to have those information in the system straight away, then they will print it out and forward it to the at the faculty level for the first screening, then only approval at the UiTM level, or REC 11 forms, which is not in the system as per yet, so it has to be done manually. So for this particular system and also RED 11, UiTM staff, non-UiTM staff, PhD student and master student by research need to look into this, right? But however, when we talk about ERC forms, okay, it will be for master students by mixed mode. Okay, that will be by dissertation and also master student by coursework. Okay, some of it will be coursework and also final year project under undergraduate student. All right, so where to apply? Okay, basically I have attached the link here. So maybe later on we can have a copy of the slide so you can you can refer to the link later. All right, I think so. That's all from me. Please get ethical, everyone. Thank you. part of the information here is from Research Ethics UiTM and also from MCRCR. That's all from me. Thank you.
Okay, thank you. Thank you very much, Dr. Noziatun. So I open the audience for question and answer. Any question for Dr. Noziatun? Thank you, Dr. Noziatun, for giving actually a lot of tips for you to fill up the forms and what to look, what to do, what not to do. I think that comes a lot with her experience, which is really helpful. So if you have any question, this is the time to share it with us.
Can I stop the presentation, Aisha?
Yeah, you can.
Boleh, ya?
Yes,
Right.
we can stop sharing, no problem.
Thanks.
I think you explained to them to the point that they've got no question left.
Or maybe we are reaching towards the lunchtime.
Yeah, that is another factor as well. So if there's no question, Dr. Hasno, shall we?
Salam.
Yeah,
I have a
good.
question.
Yeah, thank you. Please go ahead.
For the external body approval, just now what you mentioned was only for medical, but what about Kementerian Pendidikan for school, if we involve teachers or primary school, secondary school students, do we have to go through Kementerian Pendidikan, because I believe they also have a certain process, or we just apply to Kementerian Pendidikan?
Based on my experience, I have done a research basically under social science, referring to orang asli. So our project basically going to schools di Cameron. So memang we have to apply for approval from the kementerian. Then after that they will inform PPD. So after that our application akan pergi kepada PPD and PPD will look into that and they will inform the school. So that is the process. So meaning that if it involves kementerian, usually memang we have to go through that channel lah. Kalau tidak, memang we are unable to visit the schools because especially during that time, masa COVID. So jadi memang is very tedious lah the process. But now I rasa mungkin lebih mudah sebab kita dah tak ada lagi kan all those tak boleh visit and all that. So we had gone through that during that particular phase lah, masa COVID dulu.
Okay, so on top of that, do we have any reference or list on what are the bodies and organizations that we need to get external approval, macam medical board? Of course, we are aware is medical board, Kementerian Pendidikan, but other organizations. So nanti kita nak refer. Do we have a reference list or something, or kita kena cari sendiri?
Macam itulah. Maksudnya, to my understanding is kalau your research involve any kementerian, then we have to approach that particular kementerian lah for approval. Other than that, tak perlulah. Meaning that kalau our respondents are all just the normal ordinary, so tak perlu. If and unless it involves schools, memang we have to get their approval baru dan kita boleh pergi sekolah.
So macam Kementerian Belia dan Sukan. So any organisation is better for us to straight away refer to them for the procedure lah.
Yes. I did that. I did that.
At least something lah. Thank you.
Thank you.
Assalamualaikum.
Salam.
Prof, saya Faris daripada UiTM Perlis.
Ya, Dr. Faris.
Okay, saya just nak bertanya lah berkenaan dengan yang melibatkan kementerian ni. Kalau macam tak silap saya, kalau untuk bawah, seperti yang dimaklumkan oleh Dr. Syarul Nizam tadi, kalau untuk bawah 17 kita kena refer kepada KPT. Yang tu untuk pelajar-pelajar lah. Tapi ada tak macam pengalaman daripada Prof Majid sendiri dengan kementerian, macam kementerian lain lah, yang kita walaupun dia atas 18 dan kita masih perlu minta kelulusan daripada kementerian tersebut. Contoh macam Kementerian Belia dan Sukan ke, untuk menggunakan dia orang punya, macam kita nak buat kajian untuk ni lah, staff-staff dia orang. ataupun kita tak perlu ataupun macam mana? Just nak bertanya lah.
Okay, sebab I understand. What I have experienced basically memang untuk minor lah. Tapi is there anyone in my committee, ada tak yang siapa come across? I cannot answer because I'm not sure whether kalau above 18 tu adakah we still have to go to kementerian. But if I'm not mistaken, that is the procedure by the kementerian lah. Maknanya whichever involving dia orang punya organisation, definitely we must get approval. But anyway, I have not experienced that so far in my research. Maybe Dato', if you can assist me on that, thank you. Atau maybe Prof. Rohana, I have not come across that aspect yet. Or anyone?
Ataupun memang tak ada lagi lah, Doktor. Saya just terlintas je sebab tu saya tanya tadi kan.
Sebab I have not come across, tapi I think it's better for us to check dengan the kementerian itself. Kan, sebab what I did, I memang liaise dengan kementerian dulu pendidikan sebab mine respondent adalah minors kan, dan juga cikgu. So I have contacted them and they said these are the process. So I have to follow lah. Macam kalau you mungkin you just need to contact them first and see how it goes. If let's say it's not required, then tak perlulah. If unless perlu, then you have to make sure that you follow the procedures.
Tapi sepanjang experience saya, kalau untuk bawah 18 memang saya mohon lah. Tapi kalau untuk yang staff-staff yang kementerian berkenaan, saya just acknowledge je lah macam tu.
Tapi kalau ada social science, like for myself pun, bila kita collect data daripada National Audit Department, for example, or even SPRM, okay, we just need to write a letter saying that we're going to collect data and all that. So then they will allow, lepas tu baru kita collect data through Google or whatsoever lah. Meaning that to me, to get the approval from them is kind of crucial jugalah, sebab otherwise the employees will not answer, especially when it involves MACC, SPRM atau even polis kan, sebab kadang my data bahagian forensik ni lebih pada SPRM, polis, you know. So we need to write a letter, official letter to them saying that we are collecting data and all that. Then they say okay, baru kita distribute questionnaires to their staff.
Kalau praktis saya sebelum ni memang kalau untuk mana-mana organisasi memang kita akan mohon lah.
Ya.
Saya bertanya berkenaan dengan macam kementerian tu lah sebab dia lebih legal kan. Okay, Doktor, thank you.
Thank you. Yeah, even with Motek pun, I have research dengan Motek. Memang Motek pun kita minta approval jugalah from them. Then kalau Motek usually, like for me, my research is on homestay operators. Jadinya they will advise us these are the list of the homestay operators registered with them. So the ones yang non-registered atau kita kata illegal homestay operators tu, dia tak nak jadi part of the sample lah. Okay, so bila kita liaise directly with them, then we can get ideas actually how it should be done, or we do not aware all this while that homestay operators ada legal, ada illegal, you know, until we liaise with them, then we know, oh ada yang legal dan illegal. Then from there they have the list of legal homestay operators for us to get our data. So that will be good actually when we liaise directly with them. Itulah dia punya advantage lah. Anything else? Okay, Isha?
Okay, thank you very much to Dr. Nurjatun, and thank you for all that have participated.
Yeah, thank you everyone.
Okay, thank you very much. The Secretariat will share the attendance QR code shortly, and with that, I would like to again congratulate everybody who have participated. especially the current or former member of associate member of REC, and the rest of the UiTM system, lecturers, staff, and the new associate member who's going to be appointed. You will be joining another hands-on session at 2 p.m. And wait, I'll ask the secretary to share the QR code first. Okay, it's there. All right, so take your time, fill it up. It's quite straightforward. And for your information, to current and former associate member of RSC, you will be given later via email an assessment question, an evaluation form, so to speak, for you to answer, for us to sort of like assess your competency level, right? And then for new associate member who is invited to come in the afternoon session for the hands-on sharing session, I would like to remind you again, please check your Google Calendar. You should be having an invitation for another session, hands-on session at 2 p.m. right? And in there there will be another WebEx link, not using these WebEx links, another WebEx links, a different WebEx links, which you have to join at 2 p.m. And then you have to read through the notes that we have given you. We have shared with you the guide, all right? So you can read at the guide. And then what you need to do is actually look at the grouping that we have made, search for your name or your email address, right? And then you will see in that group list, in column G, there's a sample set. So you are given each randomly assigned a different set of questions, not question actually, sample application in the past that we have sort of like blinded in terms of application for private and confidentiality. So you have to try to review all 4 sample application in the set that is assigned to you. What you need to do is you have to download the reviewing form, right? And use that form to make your review of all those 4 applications that we've shared with you. On top of that, you also need to complete and sign the observer confidentiality agreement. Okay. And in the table group list, in the Excel that we've shared with you in column H next to the sample set, we have a column where the folder at which you have to upload your documents. So for each group, you have to submit in the respective folder that we've made. So I've seen in some group you have submitted your documents. Congratulations. So following that format, please do it. If you have not done it, you have like 1.5 hours to attempt all those 4 questions. And later on, the facilitator, which is our REC members, will ask any of you to present your findings, so you can explain to them scientifically and ethically your review on the proposal that is given, as well as most importantly, what risk category you think, whether it's exemption, minimal risk, or more than minimal risk. And you can discuss and ask questions from your facilitator. I mean, they are very experienced in this aspect, so make use of that opportunity, right? And then we have allocated like 2 to 3 hours for you to finish it up. I encourage every participant for the afternoon session to switch on your camera. Make sure you participate well and be active because all of this will be assessed by the facilitator. And then the facilitator will cover as many sample application as time permits. And after the hands-on session, evaluation form will be given to you via email as well. So make sure those who are joining us in the afternoon, make sure you have made your attempt on reviewing, submitting the document, because without that, you will not be accepted as associate member, and you will be asked to leave because this is a requirement for you to come and join us. So I think that's all. If you have not attempted, don't worry. We anticipated that because some of you have not gone through such a lecture or workshop as in the morning session. So thank you for joining us, and please take your time to yes.
So the existing associate member will then be receiving the link to the training too.
Yeah, so for existing and former associate member, you are only required to attend the morning session, which you have done. So you will not be doing the hands-on session again. Yes.
Thank you. Thank you.
All right. Okay, all the slides will be shared later on. Don't worry, we will email it to you, or perhaps we can just put it in our website so that you can refer it there. Maybe that is more tactical, strategic. Okay, I would also take this opportunity to thank all the speakers, all RSC members who have contributed in suggesting and making this program a success, and especially to Dr. Asno and fellow secretariat who have been supporting us. UKPV member as well under the NCPI, we very much appreciate all your contribution and your sacrifice towards making this event a success. I will see you again in some other platforms. So I hope that this answers a lot of your question, and I hope you can in turn teach or show share this knowledge with other members of the faculty of your branches, so that you can help them in terms of applying research ethics, which can be quite tiresome. So thank you very much. I would like to end this morning session with Tasbih Kifarah and Suratul As. Okay, thank you for the participant for your feedback and for your participation. We will let this QR code stay for a bit more time, and then we see you again. Thank you very much. Assalamualaikum, and very good afternoon to all.